and CMD Medanta, the Medicity, Ms. Sunita Reddy, Managing Director, Apollo Hospitals, and our distinguished moderator for this session, Ms. Amita Sarkar, Deputy Director General, Confederation of Indian Industry. Ladies and gentlemen, a very warm welcome to this special plenary session on Care Economy Ka Naya Daur, empowering the senior care, and I hand over to Ms. Amita Sarkar, Deputy Director CII, to kindly take over the proceedings of this session. Over to you, ma'am.
Yeah, may I request everyone to please settle down? Just to say that alongside the main healthcare summit, we are also organizing a series of discussions on senior care. While this is the inaugural of the senior care seminar, the discussions are going on in one floor below this. So those of you who are really interested in the subject may join the discussions there. We welcome a very, very hearty welcome to Dr. Jitendra Singh, the Union Minister of State, Independent Charge for Science and Technology and Earth Sciences, Minister of State in PMO, Minister of State in the Department of Atomic Energy and Space, and also Minister of State for Personnel, Public Grievances and Pensions of India, a trained doctor himself, diabetes specialist, and of course he's extremely passionate about healthcare, and we are fortunate that he always comes for the CII Healthcare Summit. Let's give him a big hand, ladies and gentlemen. Dr. Vinod Paul, sir, if I may call you the Bhishma Pitame of healthcare, a big round of applause, member Niti Aayog. Again, we have on stage, fortunate, Dr. Naresh Trihan and Sunita Reddy, and Neena Gupta, who actually needs no introduction, also as the others on the panel. She's happily become the ambassadors of CII Subcommittee on Senior Care. She's a renowned actor, and who better than her but to really tell us that how there can be a wonderful, productive life even at the age past 60 years. Good morning and a very warm welcome to all of you. It's my privilege on behalf of CII, again, to welcome you to the CII Senior Care Conclave. As our country experiences a major demographic shift, the conversation on care is no longer just about social responsibility, but about building an inclusive and resilient care economy. One that values caregivers as much as those receiving the care, and one that recognizes care as both a driver of growth and a foundation of dignity. So this inaugural session, ladies and gentlemen, Care Economy Ka Naya Daur, we've called it as Life Ka Blockbuster, because we want that, and we all of us desire that these years are the best years that a human being can have. Through our CII Committee on Senior Care, we have initiated this dialogue to bring together multiple perspectives from healthcare, housing, insurance, technology, and identify pathways to strengthen India's silver economy. With these, may I request Dr. Trihan to give us his insights. Thank you.
Thank you, Amita. Respected Dr. Jitendra Singh, our Minister of State for Personnel, Public Grievance, Pensions of India, and actually Atomic Energy also. And Dr. V.K. Paul, thank you for coming. There is a little mistake here. We have made Ms. Neena Gupta as ambassador for senior care. How can you take a young lady like that and make her the ambassador for senior care? So, objection. So we should say young ambassador for senior care. Okay, that will be more appropriate. And Sunita and Amita Sarkar. First of all, I must thank our Honorable Minister for taking the time out. This is very busy time for everybody. And Dr. Paul, because I just saw his schedule and he has 3-4 conflicting things going on at the same time. So thank you very much. So it's a privilege to welcome all of you to Senior Care Conclave 25. I must say that this is a good initiative started by CII under the stewardship of Amita Sarkar, because we really know, and they have named it as Zindagi Ek Blockbuster, building a resilient silver ecosystem. And I think it is really you and I think Shabnam and all have conspired to get it all together, and the blessings of all these people will only going to make it a great success. So India is actually, we have what we call the demographic dividend in our younger people, but at the same time, the aged are going to get aged more and more. And today, I think there are maybe 13 crore people who are already above the age of 60. And this shift is going to keep taking place. So we know that we will have, see, when you talk about percentage, they say 30% of people in Japan may be above elderly. Now our 3% will be more than that 30% because we are now looking at a base of 1.4 billion. So proportionally, we have equal number of people in Japan and in India who are now aging. And it's a very important recognition in Japan that a lot of people have been taken care of by caregivers, which we will also have to provide as we move forward. So one of the demographic dividends that we do have, and I also am involved with the Health Sector Skill Council, that we can actually be the caregiver provider to the world because the world is aging. And the population, especially in the Western, in Europe at least, is actually diminishing. So as we have that demographic shift in those countries and we have our ability to provide the care, I think this is a perfect match. And I think Japan has already started engaging with us, and there is a movement to provide caregivers from India as we move forward. But not to forget that we need them all in India also. So the government, keeping that in mind, has started the National Program for Health Care of Elderly, Ayushman Bharat, and the expansion of health and wellness centers. As you may already know, that the Prime Minister announced that anybody above the age of 70 will qualify for Ayushman Bharat, which gives them an additional 5 lakhs of coverage for their health needs per year. So that means a family who has already a cover of 5 lakhs and has an elderly person will now be entitled to 10 lakhs a year. So these are all very, very encouraging moves and people-looking humanitarian moves by the government. And thank you, Dr. Jitendra Singh, that he has been actually championing the cause from his position in the PMO. So we as providers also have gearing up to provide senior care, because the idea being that if we can keep our elderly safe, that malady of life which hits everybody at the last 5 to 10 years of your life can actually be keeping them healthy and mobile is only going to help to lessen the burden on individuals, on families, and the country at large. So with that, there is a lot to be said. Amita has said a lot already about aging and the care, and we have the very senior people here who will tell us about what the government's programs are and how we should look at it for the future. Thank you very much.
Before we hear Dr. Paul, Honorable Minister and Sunita, may I request Neena ji for her insights. Neena ji, you've just been shifted from the senior care to the caregiver category. Please come. Let's give her a big hand.
Thank you so much. Thank you, all the panelists here, Minister Dr. Singh, and all the people who are in the audience. When I came here, I was wondering कि मुझे क्यों बुलाया है, क्योंकि और मुझे एम्बेसडर बनाया, तो मैं सोच रही थी कि हेल्थ केयर तो ये सब संभालते हैं, आप लोग में से सब संभालते हैं, मुझे क्यों बनाया है. फिर मुझे डॉक्टर शबनम ने समझाया कि मुझे क्यों बनाया, तो मुझे समझ में आ गया. मैं ये कहना चाहूँगी, मैं हिंदी में बोल सकती हूँ ना, है ना? हाँ. मुझे ये लगता है कि सीनियर लोगों को जो आप सब लोग हेल्थ केयर प्रदान करते हैं, एक और बड़ी इम्पॉर्टेंट चीज़ उनके लिए है जो हमें चाहिए, वो है मेंटल हेल्थ केयर. मुझे याद है एक बार मैं मिस्टर केपी सिंह को सुन रही थी, उन्होंने कहा कि यू डोंट डाई ऑफ ओल्ड एज, पीपल डाई ऑफ लोनलीनेस. सो ये एक बहुत इम्पॉर्टेंट बात है कि इससे पहले मैं और बात बोलूँगी. हमारी फिल्म इंडस्ट्री में एक वर्ड कहते हैं ब्रेक. आपको ब्रेक मिलता है, मतलब आपका कोई काम है जो बहुत पॉपुलर होता है और लोग पसंद करते हैं, फिर आपको और काम मिलता है, तो उसको कहते हैं ओ आई हैव गॉट द ब्रेक. मेरा ब्रेक मुझे 60 साल की उम्र में मिला. हाँ, अब 60 साल की उम्र में मिला है तो अब फिट रहना पड़ेगा, क्योंकि अब और काम मिलेगा. तो ये ना हो कि और काम मिले तो मेरे को लगे अब तो मैं कर ही नहीं सकती क्योंकि मेरी डायबिटीज़ हो गई या मेरी घुटने दुखते हैं या कुछ हैं. सो व्हाट आई फील दैट नंबर वन फॉर द health care of senior citizens, number one is fitness. Now, what is your motivation for fitness? My motivation is that I want to work, and I have work now. People say, housewives who, what is their motivation? Why should they remain fit? कोई तो देखता नहीं मेरी तरफ मुड़ के, बच्चे बिजी हैं, मैं क्यों फिट रहूँ, ठीक है, खाती पीती हूँ, पड़ी रहती हूँ, ठीक है ना. सो द मोटिवेशन इज, आई विल टेल यू व्हाट द मोटिवेशन इज. व्हाट वी शुड टेल पीपल is that look after yourself for yourself, which is very difficult thing to do. You know, we want to look good for others. We have to look good for ourselves. Then we must have शौक. शौक को इंग्लिश में क्या बोलते हैं? शौक. शौक माने पैशन. क्या? पैशन ना. शौक बहुत ज़रूरी है. कपड़े पहनने का शौक, ज्वेलरी पहनने का शौक, म्यूज़िक सुनने का शौक, ट्रैवलिंग का शौक, योगा का शौक, नशा, ये एक नशा होना चाहिए. अब ये कैसे करेंगे? आई डोंट हैव कंपनी टू गो. देन वेरी इंपॉर्टेंट इज फ्रेंड्स. सो नंबर वन फिटनेस, नंबर टू शौक. शौक इज वेरी इंपॉर्टेंट. एंड नंबर थ्री फ्रेंड्स. I see now so many women, they go out in a group, they travel, they enjoy life, they laugh, they take care of themselves. So that is very important. I had a dialogue in a film where I say, कच्ची अम्मी में नमक डालो. कच्चे आम में नमक जब डलता है, उसको देख के जो मुंह से लार टपकती है वही जिंदगी है. लार टपकना बंद, जिंदगी झंड. सो ये लार टपकना ज़रूरी है, मतलब शौक ज़रूरी है, पैशन ज़रूरी है, उसके लिए बहुत पैसे भी ज़रूरी नहीं है। आप कहीं भी राजस्थान में एक हो रहा है म्यूज़िक फेस्टिवल हो रहा है, ट्रेन से चले जाओ, बस से चले जाओ, ऐसा नहीं है कि कोई बोलेगा जी हाँ आप तो बोलती हैं पैसे हैं आपके पास ना। सो दीज 3 थिंग्स आर वेरी इंपॉर्टेंट, एंड if we can look at these things and tell our friends, our neighbors, and push them into doing this, I think वो as an ambassador मैं ये काम शुरू करूँगी करना. Thank you so much.
Thank you, Neena ji. Very, very inspiring indeed, and we are proud we chose you as ambassador. May I now request Dr. Paul for his insights.
Good morning, Namaskar. Honorable Dr. Jitendra Singh ji, our Minister of State for Science and Technology and multiple other departments. Very honored to be sharing the dais with you, sir. Respected Dr. Naresh Trehan ji, Ms. Neena Gupta ji, Madam Sangeeta Reddy ji, Amita ma'am, above all, the leadership of health sector in India present in this hall, stakeholders for senior care present in the hall, innovators, and distinguished representatives of the industry from India and abroad present here. It's always a pleasure to be a part of brainstorming, part of sharing ideas, part of bonhomie, and be amongst you in meeting that Naresh Rehanji and CII organizes. Indeed, I look forward to it because I get a chance to learn and to share and to connect. So thank you very much, sir, for the opportunity. You have already set the stage by indicating to us the emerging burden, emerging increase in our senior population. And it is imminent that this proportion of about 11% of our population today, about 13 crore, 130 million, by 2050 will be above 350 million and approximately 22-23% of the overall population. So it's out there. It's both a dividend, it's both as well as a challenge. One of the issues that emerges on the scene, as Neena ji indicated gently, is that with the changes in our family systems, imperatives of work, the reason for children to be away from families imposes on us different ways of looking at senior care, in addition to ensuring, strengthening, building, supporting family-based care of the senior citizens. First, I wish to bring that to the attention of all of us. The default mode is that our senior citizens should be in a family. That's what they want to be. That's where they want to be. If you look at last year's survey, for example. So the first point I humbly submit here is that we must continue to discuss how we build on our traditional intention, instincts, to as much as possible to look after our elderly in our own families. How can we facilitate? How can we support? How can we make it possible even more using technology, using other ways of doing it? Maybe a leave that's available to both boys and girls, the children of the elderly, and so on. So what could be those enablers apart from creating a buzz around this, that India's model by default should be family-centered care of our elderly. And we need to not by default think that we have to be building old age homes and so on. So that's my first humble submission. We still have time to recover ground in this if that ground has been stressed as of now. The second point I wish to make is in regard to the health care delivery to our senior citizens. Here, one aspect needs to be stated up front, that there are more elderly women than elderly men. There is feminization of this elderly population. And there are more women, elderly women, who are alone compared to the men. Above the age of 70, for instance, 68% of women are widows, compared to, say, 30% for men. Overall, more than 52%, about 52+% above the age of 60, women are widows, compared to 15%. So I want to emphasize the gender centricity of welfare, health, and care, and it must never be forgotten, because that means we have to do some things somewhat different than the generic ones. Having said that, you heard from Nareshji about Ayushman Bharat Pradhan Mantri Jan Arogya Yojana expansion since last year. It's going to benefit 6 crore additional elderly people. 4.5 crore families will be benefited through this, and good work is now unfolding in that regard. It's a boon, and it's a very major effort in providing health assurance to our elderly population. But the other initiative which India is now building, and I want you to contribute toward that, spread the good word, and help do that better for our nation, is the senior care through the primary healthcare system. The comprehensive primary healthcare system emanating from the National Health Policy 2017, being delivered through the erstwhile sub-centers and primary health centers, today we call them Ayushman Arogya Mandir, is an important key. The most important platform of any nation is primary health care. And most important platform for senior care will be, should be, and must be primary health care. The thinking is around look at the elderly in, let's say, 3 groups. Mobile elderly, who can come and take services at the Ayushman Arogya Mandir. 85%, 90% are in that situation. Then there are those with restricted mobility, and then those who are, shall we say, bedridden. The needs of the senior care for health and welfare need to be tailored to different levels of capacity or incapacity. This is another important principle to remember as we create these models. The one who is bedridden, the program envisages home visits. The one who is restricted and we also would need help to be supported through home visiting. So home visiting by the health teams would be an important area of work. We are building this package, we are developing, we are rolling it out, we are learning from there. We need support from academia to refine the package, demonstrate its implementability, and we need tools and technologies that can help make it better, including telemedicine, which is an obvious one, but other things as well. And we need support from you to be able to build on that model in rural and in particular urban areas where our private sector, our outstanding private sector can make partnership with the public system. So please appreciate that primary care model of for senior care health is under development right now, work in progress. Help us do it better and help us create a system that India, Bharat will be proud of, and we can offer it an example. Right now, we are just in the early stages. We need support. We must have discussions how it can be done, and here technology can play an important role, and I'll come to that a little while later once again. Third, care economy has been rightly flagged. From the information that's available, there are 11 million plus jobs that are available. huge opportunity. But there are levels to the caregiver competencies. There are the skill level, then there are competencies that can only come through a formal course, let's say certificate course or a degree course, for example. We also have a situation where our nursing colleagues are actually coming down and serving as caregivers in other countries rather than, doing the job that they are trained for. So there is, like task shifting in a certain way. Ideally, we should have about 3 to 4 levels of caregivers, and their health sector council that Naresh Trehanji leads has an important role to play. At the simplest level is a general care to be provided to an elderly, hygiene, basic needs. At the next level, you have an elderly who needs medical help, physiotherapy, care, maybe help with feeding. It becomes more complex. And then on the top level would be a patient as an individual who is paralyzed or has dementia, has nasogastric tube, tracheostomy. It becomes complicated, but this does not require to be in the hospital once that individual is stable. So I visualize multiple levels, I think at least 4 to my mind, and this needs to be divided between the skill council. No work is in progress, but we must accelerate, and it also belongs partly to the National Commission on Allied and Health Professional, and both have to come together to be able to create an ecosystem where caregiving training and capacity development happens in a systematic way. This is again work in progress. We must expedite our job in ensuring that we create this paradigm and start delivering on the ground. I'm proud of one initiative of the Ministry of Social Justice and Empowerment. In Dwarka, they have a center called National Institute of Social Security, where there is a wonderful program of 9-month elderly care program. I think that serves as a benchmark in that particular space, and we should have escalation in that with regard to much more capacity development. At the same time, the jobs need to be created on the other hand. Once a person is trained like this, it also happens that goes beyond the range of affordability of the middle classes. So we had to keep in mind how this can be done, how this can be supported, but clearly there are opportunities and there is a dividend form by also creating this workforce for the world. My second last point relates to the technologies. We are showcasing technologies for the elderly. Honorable Sir, there is a huge scope, I'm just stating the obvious, for creating technologies for the elderly, for monitoring, wearables, prediction of adverse event by looking at body parameters, supporting the mobility, and so on and so forth. Robotics, AI, all that needs to be harnessed, and I think we should have a special program from our research organizations to support development of these technologies for India and for the world. And clearly, AI-laden technologies can be a game changer in a very big in terms of giving a better quality of health and overall care of our elderly. The care of the elderly includes the welfare measures. Care of the elderly includes ideally a worker or a person who goes periodically. We have some models from NGOs which I would like to be talked about more, where a worker goes in a time-bound manner based on the need of the individual, let's say once a week or twice a week or once a month, but provides the following 4 things. A, provides companionship, talks if they are lonely, particularly if the family part is relatively weak, communication, talking, emotional support, letting it out. Second, a quick health checkup that a lay worker can do, stating the obvious. The third is to be helping the elderly with welfare opportunities and benefits that they may have. This would mean perhaps facilitating payment of a bill or create need for sorting out documents, helping with pension, helping with bank. These are big things as we would appreciate. And the last part is to be able to help with some basic needs that happen even in good societies, like arranging food from a legitimate source. I know from a particular union territory, the social welfare secretary said, एक बड़ी ज़रूरत पड़ती है, this is Chandigarh, so everybody is well off there. खाना नहीं मिल पाता है, अकेले होते हैं, तो खाना भी हम अरेंज करते हैं सरकार की तरफ से, लेकिन there needs to be somebody who helps you with, again, technology, teleconsultations, telemedicine, helplines will help. But there is a need beyond the health that we should envisage in the rubric of welfare and care. So welfare, care, and health tend to go together, and not to forget nutrition, because bone health is an issue, particularly in women. Vitamin deficiencies are a huge problem. The anemia incidence is above 60% in the elderly and so on. So comprehensive health and nutrition needs are required. My last submission is that in addition to silver economy, for which there are many other people in the audience more capable, more enlightened in this area, how to create silver economy opportunities in the system, because this is a dividend that can be harnessed and there is a whole lot of productivity awaiting. But I wish to bring in the notion of volunteerism in the presence of the Honorable Minister. Volunteering to do activities that help strengthen the rubric of society and thereby help in development. Volunteering could be, above all, in educating, tutoring students and children. And you have a Vidyanjali helpline where this connection can be done. Helping with community libraries, hospice, volunteering, child nutrition, creches, digital literacy for children and for the elderly, for everybody, teaching, painting, yoga, serving persons with disability, legal aid, preserving water bodies, financial literacy, bank literacy, tourist guide. A lot of space is available for volunteering. What is needed is to create these opportunities in that village, in that ward, where people with capabilities or with additional little skill here can be connected to a cause. I would like us to think about how volunteerism among the elderly can also be promoted in a big way. Imagine such a large population. 80% of that, 70% of that, 60% of that is available for nation building. And it may be a cause like promoting clean water supply, testing water quality, for instance, teaching children, teaching them the right skills. We have a challenge about our children, not attaining the right learning levels. We can help in this regard. There's a huge effort, but we can build on that effort. So I want, sir, CII also to please think about volunteering opportunities as a part of nation building, and that should be a strand other than the silver economy and health and welfare that I suggest that we work on in subsequent meetings. But above all, honored to be here, and thank you very much for your deliberations. Jai Hind.
Thank you very much, Dr. Paul. And with you there at NITI, we are confident that policy pathways for senior care will be prioritized. Before we hear our Honorable Minister, Sunita, I know you have some thoughts on this as well. Can we hear you?
Namaste, Honorable Minister Jitendra Singh, Mr. V.K. Paul, member of Niti Aayog, has a passion for work. He has a passion which I think is driven by a purpose to do something good for healthcare. And I think the crux of health span, of lifespan, of having a purpose is really comes from the belief that as long as you have something to do and that you can contribute to life, you make life worth living. And, I want all of you to first look at the members on the stage. Do they look like senior citizens or silvers or any such definition? I'm guessing they're above 60, that everyone on the stage is above 60. But they are in no way senior citizens. They are citizens who have the ability to contribute. And I think that, being the fourth speaker, many of the points that I could even think of were spoken of earlier. India will be in a very unique position in 2047 when 20% of our population will be senior citizens. And I think Dr. V.K. Paul mentioned this. And he did give many solutions about how we should treat the senior citizens and make them feel comfortable, welcome, and allow them to contribute to society. We also, I think Naresh spoke about the fact that, if you look at India today, it is no longer a pyramid where we do have the demographic dividend of the young, but we're also bulging in the middle because we will have the middle-aged and the senior. So how do you bring all of this together to India's advantage? We have an opportunity now to build a very skilled workforce that can serve not just India, but the rest of the world. And we can do this, and we can do this well. It's a combination of what we as Indians are, our knowledge of Ayurveda, of looking after chronic diseases and doing it well with great clinical outcomes. It's the fact that Indians, we have this spirit of Atiti Devo Bhava, where we deeply care and are compassionate about human beings from whichever part of the world they are. I think this is an opportunity to do it. We have an opportunity to learn from countries like Japan, where in the blue zones, people live to be 100 years old, and they have a very, very productive life. It's a combination of diet, it's a combination of the work that they do, it's a combination of exercise, and most importantly, it's the community coming together. In India, we have many such examples. I think in Kerala, you have groups of people who live beyond 100. In Tamil Nadu, close to where I live, we have these wonderful Brahmin community who are productive way beyond 90, 80 and 90. And they do, and you can see it in their diet, you can see it in their lifestyle. They have exercise, they eat very carefully. It's a right combination of protein, carbohydrates, and fiber. They have, the community supports each other. They wake up in December and they go for music programs in the morning. It's a community that keeps them together, and it's a community, and like Neena Gupta said, they have must in their lives. They have music, they have entertainment, and they have an opportunity to learn every day, and they're also deeply spiritual. That gives them a purpose, and it gives them a reason for living. So with so many good examples in India, I see no reason why we cannot become the perfect example for the future. Why all of the NRIs who are living overseas cannot come back to India and say, like Dr. Paul said, that family environment, why can we not create this so that all of the NRIs who are struggling because of bad health insurance plans, who are struggling because of loneliness, and who are finding healthcare more expensive than ever before, this is an opportunity for us to really attract the rest of the world to India. The third area I would really like to touch upon is research, because whatever we do, the disease profiles are growing. The impact of NCDs could be $3 trillion, and this is what will happen to the middle part of India. Diseases, affect us a decade ahead of the rest of the world. And Dr. Trehan and all the doctors will know that this is true of cardiac. This is true of the studies we've done even on women and cancer. So at this time at this crucial time in India's history, it's time for us also to invest in research. We are looking at a huge wave of Parkinson's, Alzheimer's, dementia. It's time for us to make that budgetary allocation. We had it before, where we had a tax exemption for investment into research. Research constitutes only 1.8% of India's GDP. I think now is the time for us to really impact the rest of the world and to serve our own community. So, Minister Jitendra Singh, my request to you, please make research and in budgetary allocation or tax deduction important, crucial. It's crucial for us to really to progress, not just as India, but as someone who can benefit the rest of the world. As you see the world changing, in 2025, there will be 19 million babies born in the world. These are 19 million reasons why we need to get our act together today. Time had a picture of a baby who would live to be 100 years old. I think for that to happen, for a productive and healthy lifespan, I think the time is now, and we have 19 million reasons why we should make this happen. Thank you.
Thank you, Sunita. Now may we welcome our Honorable Minister, Dr. Jitendra Singh, for his inaugural address. Thank you, sir.
Dr. Trahan, Dr. Paul, Madam Neena Gupta, Sunita ji, Dr. Sarkar. At the outset, I have to thank you for making me a part of this unusual session, building a resilient ecosystem for senior citizens. Usually, I'm thankful that the organizers have provided each one of the panelists with the talking points, but forgive me, I usually don't stick to the talking points. I usually tend to move on from what I have heard from the earlier speakers, and that is the advantage of being given the chance to speak in the end. So having heard what Neena ji said and what Sunita ji said, I think first of all, at the risk of being little rebellious, I would say the term senior citizen itself requires to be revisited, if at all it is relevant. Rather, many of us could be Gen Z plus. And I tell you how. Because all of us belong to the world of science, world of research, world of medicine, and we've been taught to speak not without reason, not without evidence. So, and I try to qualify why I'm saying so. Because many of us who are in constant touch with the Gen Z, as I am, we have the advantage of partaking everything that they are partaking. At the same time, we have already consumed what others had consumed and what is devoid to them, which they would not be able to. So many of us were born in the black and white era, went through the Eastman color, then the technical color, then the VCRs, then through the internet, now into the social media reel, etc., etc. So I think it is, as was being mentioned rightly by Neena ji and also by Sunita ji and Dr. Trahan, it's also how you take it, because ultimately the biggest computer available is located somewhere here. So at the outset, it's not that, because from my own experience, I spend most of my time with youngsters, and that too Gen Z, because there's a lot much to learn and so amazing. The other day also I was among, mind you, the present generation is much, much more aspirational, much, much more better informed, much, much more enlightened, much, much more confident than we were. So you feel like growing up with them once again. Of course, it depends how much time the Almighty allows you to do that. Because yesterday I was in a very small town called Dhaulpur, which is an aspirational district. Haldi is small in Rajasthan. And so I usually try to reach out and spend time with their company. Otherwise, if I sit with people of my age, they start counting their years and mine too. So there was a girl from class 8. She came and said, I must compliment you. And Dr. Paul knows we have initiated a number of women-centric, girl-centric incentivizing schemes for research innovation. So there's one of the schemes called Vigyan Jyoti, particularly meant for the... She said, I must compliment you, a beautiful scheme. I mean, look at this, is a government girls' school telling me. But I have a complaint. Why did you keep the cutoff class 8 because my sister is in class 6. So the first thing I came back to Delhi, I called up the secretary, I said, no, this is the feedback and we have to take the corrective course. So I think it's also a lot much, and as Neena ji was also saying, to be fit, not only to be fit, but also make sure that you appear to be fit. Like, I'll give you an example. We were there in Calcutta, I think about 15 years back, the ceremony to release the book called Romancing with Life with Mr. Devanand. And he was there. And of course, he passed away a year or so later. So he had some difficulty in climbing the steps. So we had to climb up the stage. And since I try to learn from everybody, and I feel restless if I end up the day without learning a couple of things from different quarters. And I noticed that when he had to climb up the 3-4 steps, instead of seeking the support of a walking stick or somebody, he would just place his hand on the shoulder of someone like Dr. Tarahan and say, "Oh, Naresh, how do you do?" and jump up. So in the end, I realized that the old gentleman had climbed up 3-4 steps, just greeting people around, without making anybody realize that he was actually taking the support which otherwise would be available through a walking stick. So I don't think anybody would have noticed that I registered, I shared with many people. I said, look here, this is a passion, as Neena ji was saying, not only to remain fit, but also to convincingly make others feel that you care, I am fit. Don't dismiss me out otherwise. So I think that is one of the biggest. And of course, the body tends to dictate to you how much to eat, how much not, as you come of years. So I said senior citizen is a misnomer. The other misnomer is that we take pride and very fondly saying India is a young country. But that's only half the truth. And to add to what Dr. Trehan very rightly put it, even if we have more than 40% of population below the age of 70, the absolute number of the plus 60 is always on the increase, progressively increasing. It's many times higher than what it was at the time of independence. In fact, soon after I came into this government of the multiple departments that I am related to, one of them is the pension. So we have very vociferous pensioners associations across the country, and they were able to have a congregation. The secretary said it's going to be a big problem because all of them come out with all sorts of grievances and criticisms. It's very difficult to respond to them. So he said, how do we deal? I said, okay, let them talk the whole day. So we listened quietly, patiently. At the end of it, at 5 o'clock, when he asked me to respond, I said, first of all, gentlemen, I have to compliment you, because India has seen those times when many of our friends did not live long enough to receive a farewell of retirement. Because even though at the time of independence, the retirement age was 55, many didn't live till 55. The average lifespan of an Indian was just about 50 to 55. Now it's gone up to 65, crossing the hour. So I think the absolute number has increased, and the actual challenge for the nation, for the society is, besides, of course, which will also take care of their mental and physical health, how to make good use of them in nation building and society building. And if Prime Minister Modi keeps reiterating that for the making of Viksit Bharat, we need to have the contribution of each and every citizen of India, I think that is something seriously to be thought about. Because a person who retires from the government service, for example, at the age of 60, is not only young enough to carry on with the work, maybe at double the pace, but he's at the prime of his expertise, his experience, also his skills. So how can you let him off? And if you let him off like that, he's not always going to sit idle at home or become mentally sick, as has been said. He might turn into a nuisance RTI activist or a nuisance panelist at 9 o'clock show in the evening. So how best to make sure that So, in fact, I have suggested to the concerned secretaries to have them on the advisories and other places, so that we could actually make use of this vibrant, enlarging segment of population who are equally relevant. So this is actually a biphasic lifespan. And so also the disease spectrum has increased, as Sunita ji was rightly mentioning. Again, as I said, we are Gen Z plus. When we went to school, at least I started off from a government high school. In every month, we would be asked to gulp down the tablets of chloroquine so that I didn't get malaria and didn't infect others. Then we went through that. That age is over. Now, our youngsters choose to die for more fashionable causes. They die by a heart attack. They don't die by leprosy or tuberculosis. So we've gone that way also. We've been more experienced. Otherwise, it's Z plus or Z plus, because we have seen that age also. And now we are into an age where you are having young cancers. And as far as the elder citizens are concerned, also because they are now started living long enough. Earlier on, they didn't live long enough to have prostatic cancers, for example. Now they are living long enough. So that is where, as medical professionals, the policy makers, the preventive health care is going to be the most important challenge, not only for the elder citizen, but more important to the youngsters, because many youngsters have started succumbing to diseases which were hitherto known to be the diseases of the older age. Like, for example, when we started our practice, if somebody called up and said, I've been detected to being a diabetic, the immediate image to my mind would be that of someone in late 40s or so. Now you have young persons. So how do you allow the young, youthful energy to be squattered away, to be wasted away at the altar of these diseases which are otherwise preventable, and you could conserve their energy for the larger cause of nation building, society building? So I think preventive health care is one, particularly since I'm dealing with the Department of Pensions. Only day before yesterday, I was trying to gather the statistics. More than 85,000 central government pensioners are above the age of 90. And almost 2,500, that means 2,500, I'm talking only the central government, are above 100. And remember, this government has altered the rules. Now, after 90, you give them 95% of the salary as pension, and after 100, you give them full salary. So when I met one of them, plus 100, drawing full salary as pension, I said, now, don't worry, by the time you are 200, we'll make it twice. So we'll give you incentive. So we'll offer you incentive to live for 200 years and drawing double the salary that you got when you were actually working and getting double the salary without work. So the entire scenario is changing, but this government, of course, has handled this age group with much, much greater sensitivity than ever before. For example, soon I came into the government, there was a rule that every elderly person, so-called elderly, because as I said, that's a great misnomer, plus 60 had to produce a life certificate every year from a doctor. I said this is quite inhuman, because to ask somebody to get a certificate to prove that he is alive is something very ridiculous, because, of course, as doctors we have seen, the death certificate is very much sought after. So suppose a patient died at AIMS, he would receive calls from Bihar, his hometown, कि भाई discharge तो है ही है, death certificate जरूर ले आइयो, क्योंकि death certificate will get you gratuity, get you insurance benefits of the dead man. So survivors were more concerned about the death. So I said, so we thought we would do away, but then some of the bankers told us that there was a room for misappropriation if we do that, because they had come across a case where one of the deceased person's son kept drawing the pension of his father for as many as 6 years after the old man had passed off, because he got this checkbook signed के पिताजी बार-बार आपको क्या तकलीफ देनी, एक ही बार sign कर दीजिए, and he carefully stored it. So then we resorted to barometry, because we have all the technology available, and I would not say that will be not fair to this age group. I will not say that we have done this considering their age. I said that we have done this to bring ease of living, as we should be doing in case of every citizen. When there is technology available, why not do it for them? So we started barometry, and then we realized a large number of people have started living beyond 75, 80, when your fingerprints also not remain so reliable. So I think we were among the first in the government sector to resort to what is known as face authentication technology. You just look into the camera of your mobile, and just within 30, 40 seconds, it verifies your picture and submits it with the banker. And it's picked up very well across the country. And I would not again necessarily say that we have sought to bring this to bring comfort to some kind of old age. We have just tried to use technology to bring ease of living that should be happening to every citizen of this country, regardless of the age group. And of course, this is also the government which has brought in so many health beneficial schemes like the Ayushman, which is, I think, as Dr. Paul will bear me out, one of the best health insurance schemes, I think, ever in the world, because you rarely have a health insurance scheme which would insure you for pre-existing disease. Even if you had a heart attack, you sought premium for that, they would try to find out some way to prove that you had an underlying coronary disease which you had camouflaged. But here you have a scheme, you are detected having a disorder today, cancer, whatever, tomorrow you can go and claim benefit for it. So I think this is more sensitively done. And therefore, I think in the end, what I would say is that it would, and now of course we have opened up in a very big way to the private sector. The inhibition of the skepticism between the public and private sector is gone. So more and more we are aligned with the CII and also all the initiatives taken by Dr. Trehen and his team. And that has created a much, much more enabling ecosystem and put us on the same track as the more developed countries are. Because if we have to move on, we have to follow the global strategies, we have to live up to the global benchmarks. And for that, the distinction between the old and the young doesn't find any place when you have a close synergy. So I think what is also equally important is how to synergize the 3-4 generations that we have started referring to in our social media. So if you have Generation X, you have Generation Y, you have Generation Z, you have Generation Z plus, which I am contributing. There must be some Generation ABC as well. And how do you actually optimize that? That would be the healthiest course for India to move on. Thank you very much.
Thank you very much, sir. I think dignity of the senior living is as important as the health. Thank you for your very valuable views. May I request Dr. Trihan to give a token of our appreciation to the members on the dais. Can you quickly bring that forward, please? Dr. Trihan, can you give a tree of life to, as we call it, to the Honorable Minister, to Dr. Paul? Yeah, we can all come forward. Thank you so much. We can give it to Dr. Paul. Yeah, thank you. Request the Honorable Minister to remain forward without, of course, the tree that, yeah, Dr. Paul. Yeah. Thank you, Neena ji. We really appreciate you coming on board. And don't think we are going to leave you after this conference. You are now signed up for us. Thank you. Yeah, and one for Sunita. Sunita, if you can just step forward, please. Yeah. Now, everyone for a joint photograph. Thank you very much. Neena ji, please come.
Thank you very much indeed. Ladies and gentlemen, let's once again put our hands together and thank Honorable Minister Sir and all our distinguished dignitaries for sparing their valuable time and gracing this occasion. I would request everyone to kindly
Good afternoon, everyone. We're just busy with the networking team. We'll start at about 1 o'clock. 10-15 minutes, please. Thank you. Everyone, can I request everyone to please take your seats? Requesting everyone to please take their seats. Welcome back, everyone, and thank you for your patience. Can we settle down, please? Great. Thank you, everyone, for joining us. We start with our first thematic session of the day, Taking Care Next Generation, Aging with Dignity. This session examines how we redefine dignity, autonomy, and social contribution for India's elderly as traditional family structures evolve. We have on stage Dr. Shabnam Singh, Principal Advisor, CII, who will be our moderator for the session, and Ms. Neena Gupta, Ambassador, CII Committee on Senior Care and renowned actor, Mr. Joy Chakrabarti, Chairman, CII Committee on Senior Care and COO, PD Hinduja Hospital, Dr. Ashutosh Shukla, Co-Chairman, CII Committee on Senior Care and Co-Founder and Medical Director, Pranak Center for Integrative Medicine, Dr. Sameer Gupta, Founder, Aurum Senior and Assisted Living, Senior Interventional Cardiologist, Group Director, Cardiac Cath Lab, Director, Metro Group of Hospitals. May I request our moderator to set the context and start the session. Thank you.
Thank you. Again, a very warm welcome, and this time around, good afternoon to everybody. It's very nice to see the kind of interest as well as the engagement both from the policy makers as well as from the health sector, as well as people in general, to the value. I think that is a very interesting phenomena of the gradual change in which people are looking at aging, that aging and seniors are actually value addition to society. In the morning, I don't have to introduce Neena ji to anybody. The rest of them are well known to all of you. So in the interest of time, Neena ji, आपने सुबह सुना, policy makers भी थे. And they themselves voted in favor of looking at seniors from a Gen Z perspective. Right? यही तो उसमें सारांश था. Now, when you look at seniors from a Gen Z perspective, what kind of change would you like the government to bring in? जैसे उन्होंने कहा ऐसे कीजिए केयर में, ऐसे कीजिए पेरेंट्स को. डॉक्टर पॉल तो went to the extent of saying there shouldn't be elderly homes, you should be keeping them at home. आप क्या सोचती हैं इस बारे में? गवर्नमेंट को क्या करना चाहिए पॉलिसी के हिसाब से?
देखो, गवर्नमेंट को पॉलिसी के हिसाब से जो करना चाहिए वो मुझे नहीं मालूम, वो आप सब लोग बताएंगे. मुझे ये मालूम है कि हमें क्या करना चाहिए. आपने मुझे एम्बेसडर बनाया, अब मेरा कर्तव्य है कि मैं क्या कर सकती हूँ इसमें. मैं ये कर सकती हूँ, मेरे हाथ में जो है, मेरे हाथ में ये है, मेरे हाथ में थोड़ा बहुत सोशल मीडिया में इन्फ्लुएंस मैं करती हूँ. दैट finding a motivation for now we'll call Gen Z plus, जो पहले सीनियर सिटीजन कहते थे. Finding a motivation to live and accepting your age, very important. लोग जब बूढ़े हो जाते हैं, मैं तो बोलूँगी बूढ़े हो जाते हैं, तो शक्ल इतनी अच्छी नहीं दिखती है, शरीर इतना अच्छा नहीं दिखता है, घर से निकलना बंद कर देते हैं. हाँ, सो व्हाट आई वुड से, गवर्नमेंट जो करेगी वो आप लोग डिसाइड करेंगे. मैं ये कहूँगी लोगों को कि आप, लाइक यू सेड, द फैमिली शुड लुक आफ्टर देम. इट डजंट हैपन मच. ओके, वो सीनियर लोगों को एक कोने में पड़े रहने देते हैं, मैंने देखा है ना. क्योंकि और अगर कोई बीमार हो जाए 4 दिन तो ध्यान रखते हैं, 5वें दिन नहीं रख सकते. दे हैव देयर अदर रिस्पॉन्सिबिलिटी. सो फाइनली आई वॉन्ट टू से, as a senior citizen, when you grow older, you have to look after yourself. Nobody is going to help you. They'll help you for some time. They have their other problems, they have their kids, they have this, that. और आज के ज़माने में बहुत मुश्किल है, कमाना मुश्किल है, पैसे बहुत लगते हैं हर चीज़ में. गवर्नमेंट किसको उसको क्या क्या करेगी, हमारे देश में इतने लोग हैं. सो आई वुड से, you look after your mental and physical health yourself. हाँ, उसके लिए अगर मेरी कोई फिज़िकल प्रॉब्लम है, मेरी हार्ट में प्रॉब्लम है, या मेरा कोई कुछ और तकलीफ़ है, लंग्स में प्रॉब्लम है, तो हम जाएंगे, हॉस्पिटल जाएंगे, आप लोग की मदद लेंगे. वो सारे लोग नहीं ले सकते हैं. दिस इज़ ऑल्सो अ प्रॉब्लम विच गवर्नमेंट इज़ डूइंग अ लॉट ऑफ थिंग्स अबाउट इट. बट आई वुड से, try as much as you can to look after yourself. Most importantly.
So self-reliance as far as this is concerned. Joy, as Neena ji said, they have to look after, we all have to look after ourselves. But when we are unwell, we definitely go to hospitals. So the hospital has to be prepared enough to look after us, right? What would you like to see evolve from a support structure perspective? And I think it was, honestly, if people had heard, it was joy to my ears to hear Dr. Paul saying our brilliant private sector. So there's also been a change as far as how they view the value of the private sector. What would you suggest should be the changes? Or how would you tell hospitals to be prepared to look after senior citizens?
Thank you, Dr. Shabnam. And morning we had a lot of deliberations how our population is moving towards the geriatric side and how 13-14 crores is going to become 30 crores soon. Now, when I see for last 20 years in the healthcare sector, that transition is happening very fast. And there are many things what a hospital as a provider we can think and we should do, or rather we should right now gear up for that. First and foremost, I can tell you till 5-6 years back in India, probably we didn't have expert or specialist who can handle these patients in double digit. We didn't have enough number of expert to take care of them. So the first thing is generating experts to support them is the first thing what a provider they should ensure in their place. It will not happen overnight, but probably you have to gear up. The second thing is I divide it into 3 broader segments. One is infrastructure, one is psychosocial, another one is emotional. So these 3 components we need to ensure. What are those things? For example, whether your infrastructure facility is friendly for them to access your healthcare facility. I may not have good lighting in the hospital premises. I may not have wheelchair-friendly toilets. I may not have people who can talk and reach that level. Around a decade back, I came out. I seen a concept in Cleveland, which I don't think it is happening in India as of now. They have a communication called REDE type of communication, and one of the things they have mentioned when I was there, that you need to come down to the level of the patient eye to eye. You can't stand and talk when a patient is sitting. That shows that you are superpower and you are giving some direction. You have to be in that level. So that is a very soft part of it which needs to be addressed. So apart from the clinical expertise and some of this physical component, one of the major thing I'll feel for them is the social, psychosocial, emotional support. I am seeing over a period of time what is the kind of average number of visitors they come to see a patient when they are admitted. Just now, Nina ji was talking about that you have to take care, otherwise beyond a point of time there is no one, and exactly that I have seen in our hospital in Mumbai, because everyone is so busy. First 1, 2, 3 days, after that the number of visitors stop coming and they want somebody to be there next to them. So some of the volunteer approach what we have taken, not only for the senior citizen, for everyone, some volunteers, they come and read a book, they talk to them, they tell stories that what is going on, so they feel much better than the other way we are handling them. Lastly, I will end with, very often we come across when doctors they visit these patients, there may not be a visitor, may not be an attendant from the family side, and they bombard with the language that you have this, you have that, you have to talk, you have to get this done, but at the end they wonder what I am supposed to do. So you need to create that thing that they understand. Probably it is applicable for all patients, but I think that segment needs more. And one more thing what we have done in our hospital, we have created a system. In fact, when they come to the hospital, they may not find somebody to bring them at the right time. So we have arranged pick up, drop along with a volunteer, and discharge. They are very anxious to go home post meal, or maybe they want to go and have the meal at home, but the family members are busy in office, they get time in the evening, they come to pick up them. So when you plan for that, you see that how you can give them the comfort, so they are out because they want to be out from the facility and they want to go back home. So many of these process oriented changes also we should look for, and we should imbibe in our existing process to make it more friendly. And lastly, I will tell you, other than the doctors, a very important thing is played by the paramedical and support staff. Today, we have Japan as a country partner here, so they are facing a huge challenge, and I have seen in Netherlands, so every third person who are working, they are working as a caregiver in their family or maybe in a hospital. So we are not far away. When our population also will go up to support them, we may require, so we need to have trained people who can meet the requirement, and that is something what we should do right now. Otherwise, the days are not far. The way those countries are challenged, we are also going to be challenged.
I'll come back to you on the caregiving.
बोल दूं, कुछ याद आ गया, उसके बाद मेरे से कुछ नहीं पूछना, बोलना, मैं बोलूँगी नहीं. तो हम एक बार शूटिंग में गए, आई थिंक वडनगर शूटिंग में गए गांव में. वो वहाँ पे एक कपल है जिनको मैगसे, क्या बोलते हैं, मैगसे से अवार्ड, मैक्साई से अवार्ड भी मिला था उनको. तो वहाँ उन्होंने एक हॉस्पिटल खोला हुआ था, बहुत गांव में अंदर जाके हॉस्पिटल खोला हुआ था, जहाँ लोग बैलगाड़ी में आते थे अपने बीमार लोगों को लेके. जो भी बीमार लोगों को लेके आते थे उनसे वो उनके रूम का झाड़ू पोछा लगवाते थे, खाने में वो हेल्प करवाते थे, ताकि उनको कोई स्टाफ को पैसे देने की ज़रूरत नहीं हो, क्योंकि वो इतनी दूर से आया, वापस तो जाएंगे नहीं. वहीं पे ज़मीन में डाल देते थे एक गद्दा, वो वहीं पे सोते थे. और जैसे दवाइयाँ होती थी, दवाइयों के ऊपर का जो फॉइल होता है, बिना फॉइल के थोड़ी सस्ती उनको मिलती थी, तो फॉइल का खर्चा निकाल देते थे. एंड आई सॉ इट विद माई ओन आइज, बिकॉज दे यूज टू कम, पेशेंट के साथ रहते थे, सारी सफाई, उसको नहलाना बता देते थे, ऐसे करो. ये मुझे याद आया आपकी बात सुन के.
So at the end of the day, as I said, I'll come back to you, Joy, on this point of getting people to look after is really going to be a challenge. Ashutosh, when Nina ji spoke about medicines, as you age, you can, it's well known, the doses of medicines change. Tendency for people, जो भी आता है घर में कोई बीमार होता है, they have their personal experiences, isn't it, with all of you? हाँ, मेरे को भी ऐसा हुआ था, मैंने ये दवाई खाई थी, तुम भी यही ले लो. So the other person says, हाँ, शाम को वो गए, they go in the evening, they pick up that medicine and they start popping their pills. So there's this concept of taking inputs from everybody in the anxiousness to get okay. How do we manage this? Because clearly you have to be guided in it. You can't just do it blindly.
So what happens is these relatives are trying to show their concern, and out of their concern they are trying to advise various things. Unfortunately, in India, we don't have an OTC law. The over-the-counter medicines are freely available. Anticholinergics. I see so many patients, so many people taking pantoprazole continuously, not required, but they're taking it. Antibiotic was prescribed for a week, but they continue taking it. Anticholinergics. So what happens is the number of pills keep piling up, and the moment the pill numbers are 5 or more than 5, then drug-drug interactions start happening. You see more often of drug-drug interactions, drug-herb interactions. So we need a stronger law in the sense OTC should be defined, and plus more stricter implementation of H1 and the X prescribed Schedule H drugs. These should be only by a prescription. Nowadays, the process has started, but we need to be a little more strict about it. Plus, what I have realized is that when doctors prescribe medicines, it should be through a e-prescription. And now there are so many tools which tell you which drug interaction is going to happen. If a patient is already a renal failure patient, how much dose adjustment is needed. So these kind of tools should be used more often so that while prescribing, these errors, drug errors don't happen.
I think that's an interesting point. With artificial intelligence available for the prescribing doctor, matching it with the age and seeing where there is contradiction, they should definitely be further sensitized and reaffirmed to take care of it. That's a great point. After this, I'm going to open it to the audience. I've seen that nobody's been able to ask questions of the panelists, so please have your 2 questions ready for the panel. Dr. Sameer Gupta, you're a cardiologist and you moved into this. May I ask why?
You know, ma'am, our journey into, I'm an interventional, to all those people over here, I'm an interventional cardiologist. I'm a part of the promoters and we run a few hospitals in Delhi NCR under the brand name of Umkal Hospital and Metro Group of Hospitals. And about 4 years ago, we started an assisted living center called Aurum. We now have 2 branches in Gurgaon. And, when I was in the US, I trained in the US. When I was in the US, I was exposed to this thing of assisted living and nursing homes. And I remember that time there was this social media platform called Orkut. And on Orkut, I remember posting one day that in India there are no old age homes because all old people already have homes. Mm-hmm. And I remember I posted that. And life takes a big spin. And when I was in the US, so I had an opportunity to visit this center. And I went over there and I'm like, chal kya raha hai? All these older people, somebody's taking their oxygen tank and they're all having so much fun. I mean, in India, my grandmother had advanced dementia and my Nanaji was basically his caregiver at the age of 90. I'm like, what is, and it really got me thinking. And then I moved back to India and I saw my patients. And my patients would come and tell me, हम अकेले हैं, हमारा कोई देखभाल करने के लिए नहीं है, डॉक्टर साहब रिटायर हो गए, पूरे दिन पड़े रहते हैं, हम क्या करें? And it really got us thinking, and that's when we kind of started Aurum. And I'll tell you the biggest learning. Now we've had about 400-500 people who've come and stayed in our facility. I know the prestigious delegate upstairs said you should stay at home. But I'll tell you the biggest learning, and that is applicable for everyone in this room. See, we are all going to age. Everybody is going to grow old, you're going to lose hair, you're going to start having health issues. And when you think of aging, when you think of retirement, everybody just talks and thinks about one thing. How much money will I have? And everybody's benchmark is different. कोई कहता है 1 करोड़ रुपए, कोई कहता है 5 करोड़ रुपए, बच्चों की शादी करा दी, घर खरीद लिया, मेरा काम खत्म, मेरे पास अब इतने पैसे पेंशन के आते हैं, मेरी ये इन्वेस्टमेंट है, मेरी ये रेंटल इनकम है, आई एम डन. We think of the financial component of healthcare, of aging. Nobody talks and thinks about the social component of aging. Where are you going to be? Who's going to take care of you? Who's going to be the caregiver? Tomorrow if you fall down, who will take you to the hospital? How will you go there? When you go to the hospital, who's going to sign on that paper saying, yes, operate on this person, because your child may or may not be there with you? हो सकता है आपकी नहीं पड़ती, सास बहू की नहीं पड़ती, सास ससुर की नहीं पड़ती, whatever, right? I mean, there are all these different social dynamics that are prevalent in the society, not just in India, it's across the world. This is the problem across the world. So when you think of aging, when you think of what will I do when I'm 70, when I'm 80, when I'm not able to see clearly, when I'm not adept to technology, and that's going to happen with all of us. I mean, if you see, there are people who know how to use the computer, but people don't know how to use AI. And AI is going to, by the time 30 years later, when I'm 70, the technology is going to be completely different. I will have to be adept to keeping myself up to date. And that is the challenge. And you know, one more reality of life, जब दो में से एक बच जाता है ना, तब कठिनाई आती है. That is when the challenge comes in. When there are two of you, there's a support system for either or. But when दो में से एक, और हम सबके साथ होगा ये हम सबके साथ होगा. Either you will be left behind or the other person is going to be left behind. What happens then? These are some very, very important learnings in my life that I have taken from running Aurum.
Thank you very much. Very well said, Samir. So the social aspect of, other than the financial, what is it that we are doing from a social aspect? In the interest of time, I would love to have more conversations here, but I'd like to give the audience an opportunity. Would somebody like to ask the panel any question? Yes? Please, if we could have a mic there.
I had a question, Shabnamji, and to yourself and Joy. As both of you have started and led a lot of the CII health-related, initiatives from many years now, it's destiny and beautiful to see that CII Health and the Senior Care Conclave is happening simultaneously. What can happen between hospitals and care-based companies like us so that the partnerships can be more deeper?
Would you like?
I think when we spoke in the inaugural session, we spoke about the ecosystem, different stakeholders. So we should see how we can complement each other. My hospital, my expertise is going to be rendering care, but I may not be a very good in terms of logistics and creating the environment what you can create outside. So today, if you see, 20 years back, very less discussion was on home health care. But today, everybody is talking about home health care because that is complementing and making healthcare more accessible and reach is becoming better. So similarly, companies like you can join hands with the hospital like us and take care of them when they are at home. And very nicely he mentioned that we don't have old age home because for them already there is a home. And if you can give them the care at their own home, there will be nothing like what hospital cannot give, but you people can give.
Thank you. Thanks, Joy.
The lady at the back, please.
I thank you so much for a very interactive session. I'd like to ask a question from you, Mr. Joy, and I earlier spoke to Dr. Samir. We are in the field of spreading the awareness of dementia, and part of the thing is how can we help diagnose early onset of dementia, because I'm sure you're the professionals, you know how well it can be controlled. It cannot be cured perhaps, but it definitely can be controlled and the acceleration can be under control. I believe, and I'm trying to work with AHPI on that, how can we make our hospitals ready to identify early signs of dementia? Because where are our elders going really for healthcare? They're going to the hospitals. Do we have hospital healthcare workers? What is their level of preparedness to recognize early signs of dementia? I've seen it happen with my own mother. She went for an MRI, and she was beginning to get a little aggressive because she was kind of forgetting why is she here. And she's even forgetting where is she. It's normal in dementia. And the hospital staff was calling me. Fortunately, I knew everybody at the hospital, and they kept calling me, "Ma'am, aaj thode gusse mein hai." No, not one of them could recognize that she had early onset of dementia. She's actually getting paranoid because she's not understanding where she is. And this is like fancy hospitals, private hospitals in Delhi. So what are we saying for the rest of the country? Do we give it enough importance to ensure that there is awareness in healthcare workers?
Ashutosh, would you like to take it, or Sameer? You can split it between you two.
I'll answer that question. See, right now in India, the number of people above 60 years is 149 million. By 2050, this figure will be 347 million. We can't keep asking the hospitals and the government, how are we going to solve this problem? This problem has to come from a step back. We need to think out of the box. I think we need to have a system wherein health screening is essential for people above 60, and it should be a kind of a self-assessment tool, maybe an online thing where the autonomy comes to the person on his own and he starts tracking his own health records. A slight dip in his sodium level or maybe some rhythm abnormality. There are about 15 or 20 conditions which are common in people above 60. So if there is a system where I track these 15, 20 conditions and the person is made autonomous, he starts taking decisions for himself, we'll be in a better position. The red flags will be raised much earlier before he reaches that stage where he requires hospitalization. Because very soon we'll reach a point where the number of senior citizens will be huge and the government and the hospitals will not be able to handle this problem. So we need to think differently at the community level, at the primary level, if the person is screening himself, or there's some mechanism, a tool, wherein it also incorporates various parameters, whether the person has taken his flu vaccines, etc., the adult vaccines, plus how many medicines he is taking, is there any polypharmacy happening. So this kind of a tool will be more helpful instead of, relying on the tertiary care hospitals or the government for solutions.
Sameer, would you like to add to that?
Yeah. So, when you think of dementia, and I'm wearing the doctor hat right now when I say that, there are two components to it. One is the patient, three components. The other is the doctor, and the third is the family. For us to properly and early diagnose dementia, it has to come from the family as well, because the patient doesn't know what is happening. Right? So the family also has to kind of recognize the symptoms. Normally, when I was small, they would say, "Buddha sati aa gaya." Right? That was the general terminology. "San ki aadmi hai." Those were the words that were used. But these people actually had dementia, and that was undiagnosed. And I've seen that in my personal life also. Some of my uncles and aunts, when they passed away, some of my grandparents, they had dementia which was not diagnosed. Why was that? Because the awareness was not there. So I think building awareness and building that acceptability in the family is also very important. Because my wife, my wife is a neurologist, and she also diagnoses a fair bit of dementia in her practice. So she also tells me, I told the family they have that the person has dementia, and the family just refused. They said, "Ye kaise ho sakta hai? Ye kya hota hai? Aap kehte ho mummy pagal ho gaye?" So, that acceptability that this is actually an illness, it's a disease, it should be diagnosed, the progression can be slowed, And there are various ways in how life can still be lived to the fullest in these people. That has to come.
So it boils to health literacy, I think, to some extent, and that is what we are working at, as some of you know, in CII, to work upon the health literacy for the nation. Joy, would you like to add? And then I'll come back to you, Ashutosh, and then your last message, Nina. And
So
we close.
just to complement what they have said from the other side of it, in terms of getting people who can handle this situation. So Health Sector Skill Council, we have program where we are giving training, and it comes broadly under a category called GDA, but under that there are specific training to given for the people to get geared up who can understand and manage that situation well. So there are multiple things happening at different level, and hopefully we'll be able to manage the situation.
Nina ji, your last message to everybody. आपने बोल दिया. Ashutosh, you wanted to say something?
Basically, leading a healthy lifestyle, and keeping a watch for early signs, that is the game changer. I mean, it has to be done at the primary level. A healthy diet, healthy exercise. Majority of the people don't even know what is a healthy life. Those who know, they are not motivated enough. So health education is very important.
Yeah, so technology, health education, these are areas, to your point, Soumyajit, we are working very aggressively at CII. We'd hoped it would be ready for the summit, but it isn't. I think in another month's time we'll be showcasing what we are doing at CII for these two pieces. Thank you so much, the audience and the panel. It's been absolutely delightful.
May I please request Dr. Shabnam Singh to please felicitate the speakers. Thank you, speakers. Dear all, we are now breaking for lunch. Please join us for lunch at the Plaza Terrace Garden. Thank you. Welcome back again, and I hope everyone had a great lunch. Thank you for joining us for the next session. This is an engaging fireside chat exploring Asian values in aging with dignity, intergenerational connection, and community-based care. May I invite the moderator, Mr. Matthew Cherian, former CEO HelpAge and Global Ambassador Aging HelpAge International. Welcome, sir. In the center. Joining him in this conversation are Dr. Manami, Director of Healthcare Services Area. Welcome. And Dr. Sara, Manager for Healthcare Services Area. Welcome. Thank you, sir. Over to our moderator, Mr. Matthew Cherian.
Good afternoon, konnichiwa, namaste, vanakkam to all of you. Actually, I'll begin with the good news about aging, that today we have reached an inflection point. Then all the people in this room will have 20 more years. So most of you will live to be 80. That is the good news. And in our culture, we talk of it as Sahasra Darshi. And Sahasra Darshi means, may you see 1,000 moons. So each one of you will see 1,000 moons. And you can calculate, those of you who are mathematicians can calculate and find out. Okay, we are joined by two people from Japan. And some years back, I had the good fortune of visiting Japan in the Prime Minister's delegation when he wanted to sign MOUs with Japan. And so and part of the MOU was also aged care, and he wanted people like me to visit Japan and see what can be the collaboration sources for it. So, of course, I saw a lot, and of course, one of the lasting memories of Japanese culture was there was a combination of Buddhism, Shintoism, and you can say modern atheism as well. And but people were living very long. If you may say, they were living more than the 1,000 moons. They were almost reaching centenarians. And of course, Manami will talk about Okinawa, which has become a blue zone with people living beyond 100 years. And of course, most of you would have read of Ikigai and the purpose of life and the passion for life. And she will talk more about it. We have Sarah Abe, who is from the Economic Research Institute for ASEAN and East Asia. And and Dr. Manami is also from the same institute, and they work on Asian culture. And I will begin with talking about our own culture, what it talks about parenting. Most of you would have heard Matru Deva Bhava, Pitru Deva Bhava, Guru Deva Bhava, Atiti Deva Bhava, which is your mother is God as you are born. Then later on, your father also becomes God. And then, of course, your teacher is also God. And later on in life, guests like me, Atithis, will come and go. But when we are there, CII will treat me as God. Afterwards, I'm gone, they'll forget me. So that is how it is. So I will begin with asking Manami on... She has done a lot of research on the Okinawa prefecture, and what are the lessons that we can learn from India, from Okinawa.
Thank you.
Yeah.
Thank you very much, Matthew. Once again, first of all, we would like to thank you on behalf of Economic Research Institute for ASEAN and East Asia. We would like to extend our heartfelt thanks for the invitation. from CII colleagues. We are delighted to be here today and be part of this very important and interesting conversation. So I'm not really, I wouldn't really, I'm not an expert researcher on Okinawa, but I am Okinawan. My family ancestors are Ryukyuan. So Okinawa is actually a Japanese word for Ryukyu Island, Ryukyu Kingdom. So the kingdom Ryukyus was actually an independent kingdom before Japan came and colonized. So we were indigenous people, if you will. And we do have, therefore, a distinct culture and tradition, and which is quite different from the mainland Japan. So I would be happy to share some more of my family stories and share, but also as Matthew mentioned, my grandparents, my paternal grandparents were both centenarians, and that's actually not very uncommon in Okinawa. So from what I have observed and growing up with and surrounded by strong ties of family and members, communities, I hope to share a little bit of something that is unique, and I also something that the qualities and values that are common to many of the indigenous cultures, and I'm sure in India as well. So should I start with Ikigai or just Okinawa in general? Okay.
Whatever you feel.
Yes, and Okinawa is one of the 5 blue zones. It's from Italy and Costa Rica, Greece, and then also one in California, Loma Linda, right? And we are known for longevity, and there are many factors. I think, of course, you can talk about traditional diet, pretty much, seafood and mostly a plant-based diet. But it differs, right, in different countries and then contexts. Of course, it has, it's impacted by where you live. Obviously, if you live near seaside, of course, you eat a lot of fish. If you live in the mountain, of course, you eat more of plants. So diet is one. But I think in the Ryukyu culture, we don't really have religions like in mainland Japan, so we don't practice Buddhism or Shintoism, but we worship ancestors. So ancestors are what gives us life, right? And we are connected to our ancestors and land. And I think that's really important in how people live, because the family tie is critical. So that provides a strong social support. And when people live long, they are not lonely. Basically, the households are always, the climate is warm too, so that really helps keeping the household open, literally open. The doors are always open except for the typhoon season, right? But people are welcome, always welcome. And also, when I think of my grandparents, what I think about them is, first thing that comes to my mind is so giving people, like giving. And they always think about other people around them, right? So when I was with them, like my grandma would wake up in the middle of the night checking on me whether I'm not cold or I need a blanket or anything, and always asking me, do you have are you hungry? And offering food and things. But when I think of it, it's a natural act for them. It's really because their children and grandchildren are part of them. So it is really a natural act. It's completely effortless. So always, so that's part of the purpose. So serving others, serving around you who support your life is also actually a purpose of themselves. So they can do that. I think that's one observation I can share, but I can share later more. But I'll stop there.
Thank you, Dr. Manami. And of course, the key is food and intergenerational living. So you're with your grandparents and which we are seeing declining in India. So, Dr. Sarah, you talk about food and nutrition as being important. Of course, we Keralites and Bengalis, we love our fish and we think that is our secret to longevity. But I always keep telling people that food should always be consumed in moderation. So those of you who have eaten lunch, if you have eaten a moderate lunch, then you're going to live long. Otherwise, you're going to live less long. So could you throw some light on food and nutrition in Japan and what we can learn from them?
So thank you very much, Matthew. And I'm not Japanese, but my name is Sarah Abe, so I'm married to a Japanese. And I lived in Japan for 15 years, so I do have quite a lot of experience with cross-cultural traditions and culture. And my background is actually in cancer epidemiology and nutrition epidemiology, so I am very interested in the topic. And yes, I believe in Japan too, fish is seen as one of the key foods that contributes to longevity. But like Matthew said, it's not fish in isolation, right? It's fish and the plant-based diet, the traditional Japanese diet, less processed foods, lower sugar consumption. And so I think a lot of this, again, ties in with the culture, with the history, with the religion, too. The factors, and Okinawa, of course, has its own unique diet, but those main factors, the plant-based diet, the high in fish consumption, omega-3 fatty acids that are good for your heart and also good for the brain, are certainly forerunners in Okinawa. And then in addition to nutrition, I think also the exercise, so what you take in, but then also how you move. And it's not necessarily going to the gym, but especially when we're talking about seniors, just consistent, regular walking, which in Japan, there's many spaces for walking. We talked a little bit about this over lunch. Due to the pollution, I guess in Delhi, it's harder to find those communal spaces, but indoor spaces such as temples also now serve as spaces where seniors can meet and also have that social interaction that's good for preventing isolation, loneliness, and also keeping everyone moving.
Yeah, of course, we have our traditions of yoga, and a lot of seniors do practice yoga, and you have your Tai Chi. There are a lot of similarities, but maybe you can talk a little bit about your exercise.
Yes, so Tai Chi, I guess, is more Chinese, although it is practiced in Japan too. And Nario Taiso at 6 o'clock in the morning in a lot of the local parks, you see many seniors, 100 gathering 6 o'clock in the morning, every morning to exercise together. And yeah, this is a real community effort and not just done in isolation in the home setting.
So some of the lessons is actually food in moderation, a fair amount of exercise, and there is something more, which is Dr. Manami will talk about, because Japan's living arrangements, along with its philosophical underpinning in Buddhism, Shintoism, and various other practices which are there, they worship their ancestors. We also worship our ancestors in many ways. So there are some similarities and there are some dissimilarities. Could you highlight this in aging, how it can help?
Yes, I think Japan has evolved as a society in so many ways. But traditionally, of course, the multi-generational households were the norm, right? And children grew up with aging grandparents and great-grandparents. And also, they witnessed birth as well at home, because people used to give birth at home, right? So births and deaths were part of their life, right? So that was very close to our forerunners. But now that's not the case. So, and of course, the households are, many are living a single household, or even married but not having children. And rarely these days, I mean, if you go to countryside, we do have multi-generational household. That's rare in urban areas, because basically that's just not that aligns with people's living lifestyles anymore. And women, of course, are working outside, and they don't necessarily conform to the gender norms where women should stay at home, right? Of course, still that is the norm, but I think that's drastically changed over the 50 years or so. So I think traditionally, I think I mentioned my family, Okinawan case. I think the household, multi-generational, and also community really came together to raise the children. It's not just parents' job to raise kids, but community really came together and raised, and neighbors would, feed the next door's food. That was really a norm, and that's how children grew up, and despite poverty, right, and especially the World War II, we didn't have anything. So, but I think it now shifting. So we do have traditional culture. We value and respect for elders, of course. I think that is fundamental in how we, build our society around elder who are vulnerable, but also without them, obviously we would not be in here, right? So we have to really remember that. But I think that's a challenge actually in Japanese society now, that when it comes to caregiving and taking care of those senior citizens, we have to really look back to what we used to be and what's most important for the families and communities. So yeah.
Thank you. Thank you, Doctor. Actually, I'm involved with a survey of India, which is called the Lassie survey. And today, we have 146 million elderly, which includes me also. So, but in 2047, the Viksit Bharat deadline, we will be 340 million. So 1 in 5 people in India will be old, which is a tremendous kind of explosion. And Japan at least has managed to solve its health problems and health coverage and pension. These are 2 areas which Japan does it very well. So I'd like to ask Dr. Sarah, what can we learn from the Japanese experience?
Thank you, Matthew. So touching on these systems, universal health coverage and cost sharing, and also thinking in terms of the future, right? Like where India is going to be in 20 years from now, because that's a very rapidly aging population too. Japan had 60, 80 years, but that's happening much faster in countries like India, Thailand, Indonesia, where we're based now. So establishing that safety net where the whole of society protects the seniors and taking that life course approach. So again, getting back to prevention, so these early messaging, having healthy foods in schools and teaching the children. And again, there the seniors can actually be involved because they can do the teaching. They can share their traditions, their wisdom from the past, and educate the children so that there's more invested in prevention, which actually is economically beneficial too. Because the treatment end, even Japan, which is a high-income country, which has a smaller population than India, is also facing difficulties with paying for the high-cost treatment. Not to say that that's not important. Of course, the technological advancement is incredibly important, but there needs to be some balance and also addressing prevention, not only the treatment side, but what can be done using optimizing digitalization and through the life course. So taking things like yoga, like you mentioned, and messaging it though as a health message. So yoga equals longevity. So it's not just do yoga when you're fit, but also starting at an early age and throughout your old age too. It's something the whole community can engage in.
So good lessons for all of us. And we have Somajit here who runs IMOHA, which talks about building a community of elders. So we're hearing that in Japan there's a community feeling around the elders, and it is not just isolated. Because today's biggest problem amongst older people which I see is loneliness. Most of them are living alone in their houses. I used to go to many schools in Delhi and talk to them that the only way to combat loneliness is if you children don't think that your grandfather and grandmother are not here. In your own street, there is a grandfather and grandmother living alone. Go and talk to them, spend some time with them. So I'd like to ask Dr. Manami, how is Japan tackling its own loneliness? Because when I went to Japan, I saw that the negative aspects, there were a lot of suicides among elderly. And what were the reasons, I could not figure out. Maybe you can throw some light on this.
Thank you, Matthew. I think maybe we can also touch upon the theme of ikigai as well, which is basically, you can translate as a reason of being, right? Or it can be a plural, reasons for being, of being, and it's basically the motivation that makes life feel valuable, or things or people that make life feel worthwhile, and bring a sense of purpose, fulfillment, joy, happiness. But I think it's basically, ikigai is, I understand it, it's a love for life, right? You want to live the life you have. But I think a lot of senior citizens in Japan, I think they are isolated and they're lonely. They don't have, I think ikigai, I think it's one, if you look at from the subjective aspect, you look for something that makes you feel good, or it makes you feel, makes your life feel valuable. But I think on the flip side, I think it's more, it is a broad concept, right, that can be found in many aspects of life, but I think it's more about feeling valued by the society. When one feels valued and loved and appreciated by family members and communities and society, I think that's when people actually find a motivation to live. Right, live the life. So that's how I interpreted ikigai, and so that is the meaning of life. Because at the end of the day, I think people do want to be appreciated and valued, and I think that's what we crave for, right? What we do, professional career, family roles. I think that's what we want as evidence of our life, right? Yeah. So I think that is ikigai. And then in Japan's modern society, especially in the urban area, unfortunately, a lot of people, senior elderly, are lonely, and that's partly, again, their children or grandchildren live far away. They are doing their own, things. They don't necessarily embrace their grandparents, great-grandparents into their lives. Again, this disconnect, right? But again, I think we have to really remind us that we are because of they are, right? So I think we have to all come back to that, remembering us that, and our seniors they have so much to offer, teach us. They are basically teachers of life, right? They have so much experience, and I think we should take advantage of that by really embracing them into our life and really ask them to share the wisdom and knowledge they can offer, right? And I think there are communities intentionally creating that kind of living communities, and also bringing kindergarten children and nurseries children to, and then create the opportunity to interact. And I think that's also very stimulating and happy for the senior citizen to look. So on both sides, yeah.
Thank you. Yeah. Your parents are your first gurus.
Yes.
So, Sarah, I've been told by the organizers that we are running short on time. So, any last words?
I'd just echo also what Dr. Manami said, that we have so much to learn from the older people, and this intergenerational exchange tackles so many of the issues. And I think India and Japan do have a lot in common, and then there's some differences, but the tackling it together as a community. So it's not only the individual families or the individual children that need to take care of their parents, but we as a society together can solve these problems.
So I'll just sum up. There may not be time for questions, but the three learnings or the takeaways is eat food in moderation, exercise quite well, and try to be regular in your exercise. It's not that Monday, Wednesday I'll do and rest of the week I'll give it a goodbye. And last but not least, stay socially connected with the community. And if you can do that, may you all live a long life, and wish you all a very, very long life. Thank you.
Thank you to our speakers for such an insightful dialogue. May I request Mr. Cherian to please felicitate Dr. Sarah and Dr. Manami, please. Once again, thank you to our speakers. Thank you so much. We'll take a moment or two to just figure out the head table for the next session.
Running a bit late, and some of us, might need to leave a little earlier. So what I will do is that while they're setting the table, I'll just do the introductions so that I'll save some time. So I think a lot of what I wanted to do in terms of setting context has already been done by the sessions we heard in the morning. So let me introduce myself. My name is Jamuna Ravi. I'm the CEO of Vaya Vikas, and this is an organization which has been set up for empowering senior citizens, and it has been founded by Chris Gopalakrishnan. We've been around for about 4.5 years, and our objective is to set up an ecosystem for senior citizens where they can age healthily and also age with purpose. And Matthew's just finished telling us that a lot of us are going to live maybe beyond 80. So I think with whatever we heard in the morning today, I think the question that we must ask is, are we ready for longevity at all as a nation? All the time, I have a career in the IT industry. I've spent 35 years, and we've spent our life selling to customers about what a young nation we are. And now we have moved towards the other end, right? We are moving where in 2050 will be 1 in 5 people will be more than 60 years old. So that's the question. And today we have an exceptional panel which is representing the key pillars of this ecosystem, which is healthcare delivery, housing, diagnostics, medical technology, and elder care services. And as well as insurance in terms of how they bring us together as well. So what we need to do is to explore how these threads really come together so that the seniors feel looked after and they have a sense of well-being. Now, well-being is a word that all of us are using increasingly nowadays, including in corporates as well. So we can have a whole day discussion about what well-being means, but we don't have time for that. So what I'll do is that I'll just like to introduce the panel briefly. We have Rajat Mehta. He's the Managing Director and Chief Executive Officer of Antara Senior Living. He is also the Chairman of ASLI, Association of Senior Living Organizations in India. And he's the founding board member of Dementia India Alliance, a non-profit organization. He's also an independent director on the board of Dr. Path Labs, Lal Path Labs, and a member of the accreditation board for the healthcare sector Skill Council. We also heard a little bit about that in the morning. Dr. Arjun Dang is a visionary leader and a prominent figure in the field of laboratory diagnostics. He serves as the CEO and partner of Dr. Dang's lab, New Delhi, and one of India's most reputed standalone diagnostic centers. Neha Sinha is a clinical psychologist and a dementia specialist who has gained international recognition for creating dementia services in India. She's a Forbes 30 Under 30 honoree. She serves on the board of ASLI, the Association of Senior Living India, and on the advisory board of the Dementia India Alliance as well. As the co-founder and chief executive officer of Epoch Elder Care, she leads one of India's foremost organizations specializing in assisted living and person-centered care for individuals with neurodegenerative conditions. Dr. Rajiv Chibber is a senior corporate affairs, policy, communication and media strategist. He's worked in the past in the development sector in the key areas of healthcare, climate change, energy and sustainable development. He's currently Vice President, External Affairs at Sahajanand Medical Technologies, a leading developer and manufacturer of minimally invasive coronary and vascular systems. Vaibhav Tiwari is the co-founder and chief executive officer at Potia Medical. Potia is the largest consumer healthcare brand outside of hospitals in India, supporting patients with world-class healthcare services in the comforts of their homes. Potia has presence across 110 cities, supporting over 15,000 patients a month with over 1 lakh visits a month to their homes. Vineet Jain is the founder and CEO of Artha Senior Care, a growing network of assisted living and elder care services based in Delhi NCR. With a deep commitment to dignified aging and personalized care, he's built Arth on the belief that senior citizens deserve more than just safety. They deserve meaning, joy and autonomy. I'd just like to invite them to come on stage and please take their seats. So what we will be focusing on today is creating a continuous healthcare pathway for seniors, improving access to medicines, diagnostics and medical technologies, building dignified and diverse senior housing models, designing insurance products that support lifelong security, and accelerating collaboration across the senior care ecosystem. I'd like to say here that organizations like Vaya Vikas, which I'm leading, plays an important role in accelerating this collaboration. And that's why I'm so happy to be here today, because I've met so many people who are actually serving seniors in this space. And I look forward to maintaining contact with all of them. With no further delay, I'll just start the session. You'll also see that I'm challenged further by having 6 expert panelists. I don't think any of the other sessions were challenged like this, but I think it's a good challenge to have. Yeah. So what we'll do is that we'll start with Mr. Rajat Mehta. Question to you. As we're increasingly moving towards a world of nuclear families and NRI children being the norm rather than the exception, many seniors are looking for community living options where they feel comfortable, secure and well looked after. You have been a pioneer in this space. So could you give us a brief overview of how senior living options have evolved and also talk about the standards that are applicable, what you've learned through your position in ASLI?
Sure. Thank you, Jamna. Thank you for the kind words. And thank you to CII for organizing this conclave. So now we do an interesting survey at Max India called the State of Seniors every now and then. And I recall when we did the 2020 survey and then 2022, we found there were 4 key differences or subtle shifts in the behavior of seniors. One, more and more people wanted to live independently because life expectancy had gone up and they wanted independence but with safety and security. Secondly, the spends on wellness had gone up, which is wellness outside the hospital. So supplements, nutrition, physiotherapy, yoga, that had gone up, right? Third, they had become tech savvy. They understood a WhatsApp video call, they understood Facebook, Instagram. And the last was the spends on leisure travel and pilgrimages had gone up, right? And if I give you some evidence, so when we launched Dehradun way back in 2017, it took us about 8 years to have that community of 197 units fully populated. When we launched Noida in 2020 in the midst of COVID, it took us 2.5 years to sell 340 units. And when we launched Gurgaon in 2024, it took us 11 months to sell 292. So it gives you a sense of how the product has been accepted, how the senior care sector has evolved. More and more people are stepping into it. South obviously is the hub for senior care where this is more acceptability. So seniors do want to live independently now. There's a shift that we have seen, in them. Second, I would say the product itself has evolved. So when I used to go to Dehradun 3 years earlier, most dialogues with seniors were around cuisine, hospitality, laundry, housekeeping, entertainment. And now when you go there, you have a 24/7 ambulance. They set up a life care committee. The questions are more around saying, what happens if I'm not able to sign my hospital bill and I'm hospitalized? What will you do, right? The complexion has changed. So we really had to then change the healthcare provisions within the community, right? A doctor on campus, nurses, phlebotomists, physiotherapy, end-of-life suites, and now we are launching an integrated wellness clinic, combining modern medicine with good old ancient Indian wisdom, because the objective is to impact health span, not so much lifespan, right? So there's a shift that we have seen. As far as standards are concerned, ASLI itself had released a checklist about a year back. It's got 200 items in it. It covers, basics of infrastructure, minimum standard of services, nursing on campus, the facilities that seniors need, transparency in communication. And we have said that all developers who adopt this, checklist, we will have grant thought and do an audit. And if the audit is satisfactory, ASLI will issue a certificate of excellence. So at least there is some semblance of quality which the customers can look at. We also gave inputs to Maharashtra RERA. When they asked us for minimum standard for senior care, we gave the standards to them. We also submitted a paper to Ministry of Social Justice now for these standards to be adopted as part of the senior living, right? So I think this is a journey that is on. The product has evolved, so have the standards, and hopefully it will become the norm as we go forward.
Thanks for that. So I think you brought up the point of lifespan and health span. I think that's a very important point for all of us. While Matthew told us that we live till 80, I think the challenge is that in India, the health span is not going up as rapidly. And I think that is the challenge for all of us. So how do we make sure that the gap between the lifespan and the health span stays as minimal as possible? I think that's what we're all the people in this room are actually endeavoring to do. So I think it is a topic that we'll come back to as well. And of course, the standards, I work with very closely with the Ministry of Social Justice and Empowerment as well. And they are hopefully incorporating them in the standards. We have an MOU with them, so hopefully they'll come out with something soon. Yeah. So the next question, having talked about independent senior living options, I'd like to now talk about healthcare in people's homes. And this is something actually Dr. Vinod Paul had also mentioned in the morning, right? I mean, all of us want that the seniors can get looked after at home as long as possible. So that actually gives rise to the need for healthcare in people's homes. So there is an increased demand for this, especially given advancing age and the stress that is related to commuting long distance to hospitals, etc. There are many experienced players, and Portia is one of the leading companies. So this question is for Mr. Vaibhav Tiwari. And Portia has been a pioneer in bringing healthcare to people's homes. So how do you see home healthcare evolving for India's growing senior population? And this especially in preventive, rehabilitative and palliative care. What is the biggest challenge that you really face in providing these services?
I think home care in last, we started around 12 years back, and the last 12 years we have seen it evolve quite a bit. I think earlier when it was more about big cities and people who could really afford and wanted to do that. But especially post-COVID, we have seen a lot more demand for quality home care even in tier 2, tier 3 cities. And that is something which we have seen significantly. Even we have seen other ecosystem players also looking at home care and saying how they can leverage it. I mean, insurance companies have started looking at it and saying, can they use home care both for value-added services to provide to their patients, to their member base. Also, to create policies. So we are seeing in last year and a half, multiple companies have looked at creating policies which have home care covered under that. Of course, very early days, but I think that's the big evolution we are seeing. In last 2 years, I've seen insurance show enough interest in this, and pharma companies are showing enough interest in this. How do they reach out to customers at home? What they can do to support them? What value they can provide? So home care becoming central piece of, or at least an important piece of healthcare ecosystem has happened in the last 4 or 5 years. We have seen that traction, especially post-COVID. That is something which is there. But other than that, I think if you're asking from challenges perspective, I think big challenges still remain. that getting the right manpower, making sure they are trained, making sure your quality is consistent across the country, those kind of disintimidation by the patients. I mean, India is also a very value-seeking country, right? So patients continuously look for, like, should they do it with you, or is there a way to disintimidate? I think those kind of challenges are still there. But I would believe from policy perspective, most important thing to invest in a cadre which will see this as a career and will continuously work on that. And also, given that home care is fairly stressful for the caregiver or for the clinician who's going to patient home. So there has to be full-fledged structure around supporting them. I would say that is another big need which is coming out more and more, given that, I mean, we ourselves probably have trained more than 50,000 caregivers in last few years. So, and those kind of people, they continuously go out, they will work in the same industry somewhere else, or they will probably get into some other industry. But if there's a way to bring all of that together and say, okay, this is like a segment which has to provide caregiving at home, and what we can do to create a support system for them. So we make sure that this is seen as a career, which becomes a very important thing. So I would say those are the key points which you have to work on. So promoting insurance a lot more, saying that, okay, if home care gets covered under insurance, the penetration of home care will change. Today also 99.99% cases, home care is paid out of pocket. Whereas countries like US and all is basically completely driven by insurance. So we know with country aging, it's very critical that a home care gets a leg up. For that to happen, insurance has to come into play. So I would say getting insurance coverage, and second, making sure working on the capacity, how can you create capacity which is consistent and uniform in that sense is very important. So.
Yeah, I think you raised a very good point about insurance. In fact, I think we've also begun our discussion with corporates, and corporates also come back and say this. It will be much better if the insurance is covering a lot of these things, because most people are beginning to use them increasingly. So that is definitely a challenge. So diagnostics is increasingly becoming the front line of preventive healthcare. So accessibility of good diagnostics, it's a primary objective that has to be achieved by healthcare services. And there are many innovations that have happened in recent times. And also Vaibhav also mentioned about pharma companies also getting recognized and whatever. But I think diagnostics, how has it evolved? So this question is for Dr. Arjun Dang. What role can early detection and regular screening play in extending the health span of seniors, not just their lifespan? And could you talk about your experience in cutting-edge analysis that you provide for Alzheimer's, etc., using biomarkers, as well as any other innovations? Thank you.
Thank you, ma'am, for that lovely and very relevant question. And before I start, my thanks to CII for having me with all these stalwarts next to me. Now, this is a subject that is extremely close to my heart. And of course, because of my Dadu and my interaction with him, and also the innovation that we've done was, of course, his blessings, and also inspired from him and his last days. Now, ma'am, the way that I look at lifespan, health span, everyone's talking about it here, but the way that I look at it, lifespan is the number of years you live. Health span is the number of years you live truly well. Now, from a perspective of our seniors and elderly living truly well, that means three things. The first thing is their memory should be intact. Second is that independence should be completely preserved. And third thing is that their dignity should be uncompromised. Now, I still remember with my grandfather in his last days, he couldn't walk without the wheelchair, as in he needed a walker or a wheelchair. But still he didn't want the helper to come with him inside the toilet, although he'd had 3 slips there also. So that got me thinking, where independence and integrity for him is at such a high level, why are we as a country that is so large, so diverse with all the AI and all the innovation, why are we ignoring brain health to such an extent where today Alzheimer's, a thing like dementia or Alzheimer's, that's about 70% of all dementia cases, is actually diagnosed either with an amyloid PET that is absolutely not available at all. Second is a CSF analysis. That's one of the most painful OPD procedures that one can get. So of course we got working in developing an entire ecosystem for Alzheimer diagnosis that actually works like a time machine that can intervene in time before the decline becomes your true destiny. And for that, the ecosystem that we've launched, again, is a 3-part process where the first is actually the most fun. It's like a digital quiz that you take on your phone, your iPad, your laptop, and we make you play some cool games. And these games are like the ones that you would have probably played when you were a child. So it basically gives you a brain aid score. This is across 3 domains. The first is memory, the second is attention, and the third is executive function. So based on that, you get a brain aid score. And of course, if that brain aid score is more than your chronological age, then you go for the next step of testing. These are a very simple blood test. These are the world's first FDA-approved blood-based biomarkers for Alzheimer's. This basically looks at your p-tau 217 and AB 40-42 ratios. There's a lot of literature around this. This test has a very high negative predictive value. That basically means that if you test negative in this, you are clear and you don't have Alzheimer's. But of course, if you test positive, then there's another blood test that's a proprietary algorithm that gives an APS, that's an Alzheimer's probability score, and tells you for sure if you have Alzheimer's or not. So I mean, from the world of spinal taps and CSF analysis and expensive and accessible PET scans, I think what the team has managed to achieve today with these blood-based and digital health screening tools for Alzheimer's is very path-breaking. And of course, we are working closely with neurologists as well. But I feel that also apart from brain health and dementia, the other area also that I see currently is that a lot of diagnostics, ma'am, is very one-size-fits-all. So if there are 2 individuals, again, talking about the elderly and our seniors again, if there are 2 individuals, and like sir was saying that wellness spends have increased drastically, why are we doing the absolute same test for both of them? I mean, you have these silver, gold, platinum, ruby, diamond kind of packages. There's so much redundancy of tests. We have to look at, so what we actually launched is a free of cost website. This is called Discover, where anyone across the globe can log in and put in a health goal. For example, even with seniors, someone might be battling autoimmune disorders, whereas someone else might be battling gut health issues, whereas somebody might be under oncology treatment, someone might have dementia. Why are we doing the same tests? So this proprietary algorithm that we have actually asks you a few questions based on your health goal, your family history, and also your previous medical records, and gives you a personalized health package that is very relevant to you. So just to conclude, I think innovation is key, and I think this is where all our focus and compassion should be to help our seniors.
I think that's very interesting, and I think the focus of what you've said is that preventive health checks are the key, for us to all to be as healthy as possible. I think it does require a lot of, kind of education for the seniors as well, because a lot of us are very reluctant to do these tests because we're very afraid about what it will uncover and how our quality of life will change. Like, for example, if we discover that we are prone to Alzheimer's or something, I think we worry about how everybody else will start looking at us. So there is definitely, I think the CII group which is working on this, I think needs to also focus on increasing the need for awareness amongst the people. So I think we'll go on to Dr. Rajiv Chibbar. So you were instrumental in formulating the universal healthcare coverage policy in the initial stage. And could you please tell us how insurance coverage has evolved really, and how appropriate they are for seniors today, given all that we are hearing?
Yeah, thank you. Hello. Yeah. So, I think a lot of our speakers earlier talked about how inspiring it is when we talk about aging health and all that. But let's for a moment go back to what Professor Vinod Paul said in the morning, and he talked about almost around 300 million plus people by 2045 or 2050 will be at the age group of 60 plus. Now, this required the government of India to not only look at a demographic transition, but a policy transition also. So, way back in 2017-18, the Niti Aayog created the Universal Health Coverage document, or that doctrine. An important facet for really talking about out-of-pocket expenses was the data that came out from the elderly people. And that is when, we talked about we need an insurance in India, we need, something like an Ayushman Bharat that can provide universal health coverage that actually, takes care of out-of-pocket expenses, although it's taken them almost 10 years to induct elders into it. It was only this year in January that the Honorable Prime Minister announced that elders will be a part of the Ayushman Bharat scheme itself, and 70 plus. We're looking at not only 70 plus, but moving it down the ladder to 60 plus, etc. But that's an area that was really triggered, and that triggered how universal health coverage, was transpired in India. Immediately, the next question was, who's going to pay this? A lot of people who were there under the Ayushman Bharat scheme were not able to really bear those expenses. And the state governments as well as central government, they came up with a plan that this should be insurance-led, paid by the center, and then let's start getting hospitals into it. There came, the protection facility of involving insurance providers. There was initially a beeline of insurance providers who were willing to, look at that 50 crore people who were a part of the Ayushman Bharat system itself. Today, although the number of insurance providers have gone down, but the insurance coverage has started to increase. And if you look at how insurance has increased state by state, from 5 lakhs to, in certain states like Gujarat, in Rajasthan, in a couple of northeastern states, Madhya Pradesh, Odisha, down south even in Tamil Nadu and Kerala, they've increased it up to 10 lakh rupees. So insurance has been an enabler to look at how out-of-pocket expenses at that age group can now be looked at. So that was a part of the policy that the government thought, and slowly I think it is plowing into the system, because it's not only the center that is giving weightage to it, but states have now also started inviting, apart from insurance, pharma and medtech companies to provide at least affordable drugs and vaccines and medtech devices. I come from a medical device company, and we are into cardiac care, and that's something, when you look at old age, non-communicable diseases like heart health, diabetes, dementia, Alzheimer's is something which will kind of increase on a regular basis. So from a manufacturer point of view, we also came up with an affordable product on aortic valves. It's a huge cost that was there, but today it's there. Even from a manufacturer perspective, stents that we manufacture, we're globally leading as a company. We were able to, in 2017-18, also price cap it so that affordability can be looked at. So from a policy perspective, I think one thing that I would really echo from those days of 2016-17, when the universal health coverage doctrine was there, was the word AGE, the acronym that was formed by the government, AGE, and that technically meant advanced. It secondly meant generational, because it needs to also serve generational purposes, and the E was enabling. So that's how age was looked at it at that point of time.
Thank you. That was very helpful. However, I think, my perception from where I'm working in Vaya Vikas, I think it's still a huge point of stress for seniors. They don't feel that they're very well covered. And I also feel that even this Ayushman Bharat, we actually helped about 5,000 people actually enroll for the scheme. But a lot of them came back and told us that the hospitals are still not accepting it. So it is a challenge we have to resolve.
That's, in my remarks itself, I said, it took them 10 years to include
so we
70.
have to resolve that,
Yeah, so we're still on it. I think 10 lakhs coverage, the moment they said 70, they included 10 lakhs as a coverage. They may increase it. We are hearing that by 2030, there'll be another package that will be there for 60 plus, and then that will increase to up to 25
I think the
lakhs.
last mile connectivity of Ayushman Bharat still has to be worked on. Thank you. So now we'll go on to Mr. Vineet Jain. ARTH has focused on creating purpose-driven care environments. What models of housing and care are emerging as sustainable, whether they're co-living, assisted care, etc.? And how can you also integrate healthcare and community living into a single place?
Thank you for that question, Jamuna. See, when we talk about sustainability in senior living, we are mainly talking about providing long-term housing solutions, integrating that with long-term care requirements of the elderly, and being a helping hand with them throughout the aging process. the three segments that you mentioned, co-living, community living, assisted care, memory care, and I would add to that palliative care. They're all aspects to the process of aging, right? So a 65-year-old looking for companionship might be looking for a senior living, community living space. But 5-10 years down the line, they may require assisted care, memory care, or palliative care. So providing and designing a system that provides continuum of living and integrates healthcare, housing, and community together is the way forward, especially now that, currently we have all three segments operating in our country independently. But if you're looking at 2050 India, where, 1 in 5 elders, 1 in 5 people in our country would be above the age of 60, and even the super senior population would be drastically increasing at that time, building continuum of living, integrating all the three aspects together, and so that it minimizes the displacement, emotional displacement as well as physical displacement of the elderly, would be the way forward going forward.
Thanks, Vineet. So now we'll come to Neha. I think we've been, in fact, talking about dementia a lot during the day as well, and in different levels. So what I'd like like to ask you, Neha, is that EPOC has worked extensively in specialized dementia and assisted care. And how can we design care that's both clinically strong as well as emotionally empathetic? And are there any structural gaps that are still there in the healthcare system, especially in geriatrics and dementia, before they can really be considered mainstream? And I'd just like you to talk a little bit about Dementia India Alliance as well. I know that, it appeared in Rajat's profile as well, but I think not many people are still fully aware of it. So if you could just mention that as well.
Sure. Thanks, Jamuna. So, I think I see this as a combination, dementia care specifically, and in fact I'll extend it to elder care, as a combination of science and soul. So for me, it truly, the last decade has been that in implementing this. And any good elder care is an intersection of clinically strong protocols or clinical strength as well as human connection. It has to be that. And dementia care in particular cannot be medicalized. It needs to be deeply person-centered. What does that mean? That basically means that we can't take away the person from the clinical condition. That's literally a care philosophy that I've practiced and implemented in our homes. And this doesn't come from sentimentality, it comes from neuroscience. And essentially it means that if we have rhythm, if we have continuity, if we have trust, you have low cortisol levels, and we are all aware about the stress hormone. And that literally changes how the brain processes and accepts care. Therefore, when you're looking at the neurodegenerative space in particular, you can't look at it only as a clinical condition or as a medical condition. So a practical, since I'm an execution person, how do we do it? So everything, the protocols come from science. As a CEO, I can design processes, but truly execution needs to come from empathy. And I think somebody in the audience here was talking about how she struggled with her mom in the scan and when they got angry. Sure, early detection is an issue, but there's also the part of empathy which can be trained much easier. How do you respond to that? I think that's a very important part of how we execute care. Coming to structural gaps, I think one of the main things that I have personally struggled with is we need to be very clear with that about geriatrics and dementia care. It doesn't sit squarely in either medical policy or social work, social welfare in a structured way. So what happens is it's underfunded, it's unregulated not completely regulated, so it slips through the cracks. And if it is not covered under insurance, then elder care will always remain a right. Remain a privilege and not a right.
And one line about Dementia India.
Sure, sorry. So Dementia India Alliance, I think, phenomenal work. I think both Rajat and I have been involved, but Dementia India Alliance does a lot of awareness. I think that's one of their biggest achievements, it's almost like a movement. It's, I think, quartered in Bangalore. They focus on early detection, screening, training programs, 3 of the most toughest things that we have not been able to execute. So they have extensive tie-ups with the healthcare system as well as the government. So anybody, and they have a free database, you can enroll for free, you can get your early screenings done and also get enrolled in a management plan. So they're really looking at a 360 degree.
So I think even Vaya Vikas is also partnering with Dementia India Alliance as well. So I do think that they're doing some great work. So I think in the interest of time, we've actually touched upon the aspects of housing, healthcare and insurance individually, and also talked a little bit about how they're coming together. I think each one of you have also covered that a bit. But I'd just like to now end the panel discussion with a question to each one of you with just, maybe a line or two about what you think is broken. What do you think needs to be fixed in your respective areas where, it'll enable you to do much better in what you've set out to do. So I'll start with you, Rajat.
Sure. I think we've already talked about insurance and capacity to serve, which I think is a big issue in India, because still 95% of the senior expenses are out of pocket. And seniors don't like to ask their children for money. Yeah. Right? So I think insurance is an important part to play. I think let's give a dimension to capacity to serve as well. I mean, we already have, 15 crore Indians. They themselves will need about, maybe 18 to 20 crore caregivers. Where will they come from? So I think we must work on that. But I think what is really broken from my standpoint is there is no single nodal agency looking after standardization and norms. So there are many fragmented players which are offering different kind of services with no, regulation at all. So I wish there was one nodal agency which would set in place all standards and norms for different kinds of senior living options.
Very well said indeed. We'll go to you, Dr. Dang.
So ma'am, I think very relevant to close this session with this answer. What I feel is that with the way that the industry, and actually I don't like the word industry because it's a profession, but I think lab tests are becoming parameters, or patients are becoming parameters, and of course clinicians are becoming consumers of data. I would actually like to, of course, see what Neha was also saying, that empathy, trust, and that patience actually is critical while we look after our elderly. So I think that's the missing link.
Well said. What about you, Vineet?
Yeah. So to add to that, just the raw number that we're talking about in India, you're having 350 million senior citizens. So, that looking at it from a macro point of view, that's more than the entire population of the United States. And just to have the workforce, the caregivers, there's multiple organizations that are doing a tremendous job there. But I don't think, as of now, we are prepared to have that workforce who would, at the end of the day, provide those caregiving responsibilities.
Yeah, so I said that, when we created that acronym AGE, we talked about advancement, we talked about generational as well as enabling technologies being available. But, the whole thing would go amiss if we don't have insurance protection in that sense. And whatever we may do, if that's not provided by the governments, if that's not provided by federally funded, it will still remain an out-of-pocket expenses. We may not rely wholly on hospitals or medtech companies or pharma companies. We still would want insurance to be something which is not out of pocket and a burden to someone.
Said. Neha?
I'll add skilled workforce. You can't do anything without people, but we are only I'm not just talking about geriatricians and geriatric care. I think the ability to recognize cognitive decline and changes in behavior is not just restricted to dementia. So primary and secondary centers should have the training to recognize these symptoms and address them.
I think we talked about insurance and capacity, which are the biggest ones which we require, of course. But I would also say that for us to create capacity or create a skilled workforce will take years. We still struggle with having right nursing capacity in this country, and as this healthcare need has picked up. I would also say if there's a way to start promoting uses of technology. I mean, how do we do that? Do we subsidize it, do something about it, point of care devices and things like that? Because that will also ensure that you can do a balance between people and technology. Because I don't think that we are going to solve this problem only with people. I mean, we are discussing during lunch break also, the same sort of people keep rotating everywhere. That's where we are. And that problem is not going to get resolved in a hurry. So if it's a way to leverage technology as a funded initiative, if there's a way to put it, I think that's something which can solve this problem in short term and can create a roadmap for long-term solutions for this.
So I think, I think we've had a very good discussion in terms of the time we had and the number of people we had. I can really call out what I heard, largely the insurance. I think there is a problem. The standards, it's broken, it needs to be fixed. We need to have a proper system for that. And then also about caregivers. I think they are not trained. Skilled workforce, more of the same. I think we don't have people really coming together to solve this or even talk about this. Of course, we heard these also from Dr. Vinod Paul today. And of course also empathy and compassion. How do we deliver all these, And of course, what I would like to just add to this is, I think somebody talked about it in the morning, is that we as a set of people also in India need to be much more aware than what we are today about the things that can happen, especially at people who are people, just normal people, everyday people. So I think, there needs to be a lot more awareness which needs to be spread, and I think we all need to, play our part in that. That's something we have to do. We have to also fix insurance for people who cannot afford to pay, How do they really, the underprivileged, how do we really fix them? I think none of us really have talked about underprivileged at all today, and I think that's a big gap, So we really have to figure out how we address that as well. We have a lot of seniors who can afford to subsidize, underprivileged people. There is no system of even reaching out to them. In fact, Chris keeps saying, at least even if you say that one well-to-do senior citizen supports one underprivileged senior citizen, we can go a long way. And maybe, we can do something about that. And of course, I think we talked about innovation in diagnostics and also the ability to maybe, look for signals for Alzheimer's, dementia and all that. But are we as a country prepared to detect these early, both financially as well as emotionally? I think is what we have to also worry about and see what we can do to address these. So with that, I'm done. I think I'd just like to say that, the future of senior care is just not about living longer. It's just about living better. And we really need an integrated ecosystem where healthcare is continuous and compassionate, medicines are affordable and accessible, housing is dignified and inclusive, and insurance is designed for lifelong security. With that very tall order, I think I'd like to close. And thank you very much for being here on this panel today and sharing your thoughts and concerns. And I'm sure we'll all continue to work with each other in making this happen. Thank you.
Thank you, esteemed panel, for this. May I request our moderator, Ms. Jamuna Ravi, to please felicitate our esteemed panelists.
Thank you very much.
Dr. Chibber, may I request you to felicitate ma'am once. And requesting Dr. Chibber to please felicitate our esteemed moderator. Thank you.
Yes.
So we'll be directly moving on to our which is a heartfelt and emotion-filled session, Zindagi Ke Rang, Kahaniyan Dil Se, where we'll have real stories of resilience and lived experiences that take center stage. To deliver the welcome address and set the context, may I please invite Mr. Himanshu Jain, Co-Chairman CII Committee on Senior Care and Founder and CEO CII.
Hello everyone. I'm Himanshu and I'm the founder and CEO of CII. I also am the co-chair for elder care senior care program with CII. I would like to invite some of the actual seniors. I think we have heard so much from all the industry leaders, coming up here talking about what they are building and what needs to be done in this industry. But I think the most important thing that we are missing out is the real stories of seniors. And for that, I would like to invite Ms. Rashmi Gautam, who is the accomplished educationist, renowned author, and certified parent coach, to come and share her story on the stage. Please come.
Is it just me or other people as well?
Are we gonna?
I think I'll just introduce everyone and then maybe you can set the context. You set the context.
Sure.
Yeah? Ma'am, please have a seat.
Yeah.
You can also have a seat and then you can.
You want me to?
I have their profiles.
Okay, sure.
Thanks. So Ms. Rashmi Gautam is an accomplished educationalist, renowned author and certified parent coach with an illustrious career spanning over 2 decades. She has served as the principal for CSKM Boarding School Mehrauli, Riverdale High School Dehradun and St. Stephen's School Panipat, and currently serves on the managing committee of 3 premier boarding schools. As a teacher trainer with NCERT, she has conducted extensive workshops on early childhood education and teacher development. A prolific writer, Ms. Gautam is also the author of 8 educational books and has contributed to pioneering initiatives like the environmental studies curricula in schools. Beyond academics, she is a motivational speaker, a certified naturopath doctor, and former Times of India school coordinator. She is known for her dynamic personality and passion for holistic education. Her creative flair, love for fashion and dance, and compassionate work as a child counselor as well as parent coach reflect her belief in nurturing both intellect and emotion, making her a true inspiration in the world of education and personal growth. Next, I'd like to invite Ms. Sagarika Mukherjee.
She's very young.
She is, should I mention?
74 young.
74 young. Ma'am also would like me to mention that she's 74 and very young. Welcome, Ms. Mukherjee. Born in Madras to a Bengal family, Ms. Sagarika Mukherjee is a historian and educationist with a postgraduate degree from Madras Christian College. Early in her career, she worked with renowned scholars at the Indian Council of Historical Research and gained strong archival expertise in the National Archives. She went on to teach at Lady Doak College, where she mentored students through theatre and community outreach. After moving to Patna, she taught at the Notre Dame Academy, directed student productions, and led impactful social service initiatives. Selected by CBSE in 1992 to represent Eastern India on an educational tour of Japan, she gained exposure to global educational systems. She has authored widely used history civics textbooks for Bharati Bhavan publishers and later served at the Chanakya National Law University and as principal for the Shemford School. Her book, Beneath Her Quiet Courage, reflects her lifelong commitment to learning and service. Welcome, ma'am. Next, I would like to call upon Dr. Asha Gauri Shankar. A round of applause, everyone, please. Dr. Asha Gauri Shankar believes retirement isn't an ending, but the start of a new chapter. A mathematician, educationist, author, and committed social contributor, she has taught underprivileged children through multiple NGOs and served as a Shri Shri Sanskar Kendra teacher with the Art of Living Foundation. In 2020, she founded SOCH, the social organization for conquering hunger, with the mission Bhuka Na Soye Koi. After completing her PhD from the Imperial College of Science, Technology and Medicine, London, she served as Professor of Mathematics at Lakshmibai College, University of Delhi. Her passion for teaching led her to revive her YouTube channel, Maths with Asha Gauri Shankar, just 7 months ago, and it has already grown to more than 75,000 subscribers. She also has over 155,000 followers on Instagram. A huge round of applause for the feat on that. A vibrant Khayal member, she continues to bring energy, wisdom, and warmth wherever she goes. Welcome, ma'am. And last but not the least, I would like to call upon Ms. Kamla Naroya. A round of applause, everyone, for ma'am as well.
I suppose सबने खाना खाया है round of
A 70-year-old lively and loving member of the Khayal family. After losing her husband in 2016, she found new purpose through Khayal. A lifetime member for the past 5 years, she enjoys events like singing, yoga and tambola. Her favorite is singing, which brings her immense joy. Kamla ji says Khayal isn't just an app, it's a family that helped her rediscover happiness and companionship. Over to you, Mr. Jain, to take over the session. Thank you.
Yeah, I think, it's more about their stories. So, with any further ado, I would like to, let Rashmi ji take the mic and, please tell about your story. And then one by one, we can have all of you to, talk about your stories. Yeah, please go on.
Good evening, everybody. It is such a pleasure to see so many people having the same goal, trying to work on the same issue altogether. What I have to say is that senior care should just not be a paraphernalia. Actually, hands down, things should be done. There are many seniors institutions, but if you really go to them, you will be very surprised and shocked. Things are not happening the way they are imposed, the way they are printed. And this is regarding what I want to say in general. And as far as I am concerned, I would like to discuss a few of my experiences. I am just gone into 75th year, and when I was 70, I have already taken a lot of attention from the society and appreciation by way of being author and teacher trainer and psychologist and consultant for setting up schools in this country, and I did that very beautifully, and being on so many other panels, which is no point telling here. Now suddenly what happened at the age of 70, I was my own happy self, but suddenly it almost showed that things have stopped. Rail gaadi ruk gayi hai. Where to go now? I'm not going to any institution now anymore. So what do? So a time came when I started feeling very low and down. It is not that I wanted applaud. It's not that I wanted that. But right from being hyped up with so much of applaud and not getting any, not even appreciation, that came as a setback. So, ladies and gentlemen, you will be very surprised to know I believe in this because I am myself a psychologist. I went to a psychiatrist I said, I'm not able to handle this. They said, okay, let's do some therapy, try to do something. And one night I was sitting with my Facebook, and there came Emoha Elder Care. So I just clicked on it and I said, let's see what happens. And lo and behold, today when you see me sitting here, putting on these kinds of clothes and looking cheerful and happy, and I would want to share to you that I'm one of the very few women who is blessed of not having even a single medicine throughout the day. Of course, I am a yoga freak, but when I came to Emoha Elder Care, I noticed two things there. Everybody that I met there was so much down to earth. If you people want, I can change this whole of my way of speaking into a very techno kind of a speech. I can do that. All the emotions and the developments and the technology and it's no point. The idea is to deliver goods. Now, when I came across Emoha, I first did not take it very seriously. I said it could be one of the other ones that come on the, Facebook. So I thought, what's the harm in trying? When I tried it, I'm till today thanking God for it. Because it is not just that Emoha cares for me. Emoha also entertains me, keeps me absolutely busy. I read my Times of India, which I am hyper about, at 10 in the night, and that is because Emoha. They keep me so involved. Now let's get back to what happens when your children are abroad and you're all by yourself. And that is what is with me. One daughter, Dr. Tanvi Gautam from Singapore Management University, she is the director there, and she has got the title for 500 most enterprising women in this world. She's a global celebrity, and when she was asked, how come you reached here? What do you feel about reaching here? You will be surprised to know. She says, I do all this. I hop from one country to the other doing programs because Emoha is there. Because Emoha Elder Care is there. By God's grace, I had to go to Emoha and take assistance only twice. And look at the speed, the way it works. You press the button on your phone and it comes on the screen, we are on our way. The first satisfaction we get is we are not alone. I have been staying alone for the last 25 years. When the people came, they took me to the hospital. I had severe stomachache, which is the only problem I have, and I was taken there, and you will not believe it, I did not have to raise my little finger. My insurance, my getting me a room, and getting me to emergency, everything was taken care of by two people from Emoha. Now, this can be done by many other institutions, but what cannot be done, and which is not possible, and which is very rare. I was in the ICU, and the gentleman who was supposed to take me off Emoha, he signs for me because my sister's family that looks after me had gone to Dubai. He signs for me saying, I am signing on behalf of Rashmi Gautam, who is going into ICU. Such a big risk taken by Emoha. And I was taken care of, I got all right, and I came back home. And the person kept standing outside the ICU throughout the night. And in the morning, something very important, everybody was talking about everything just now, but nobody talked of, भाई इमोशनली भी तो चाहिए होता है कुछ, हर चीज़ के बाद. तो The name was Murli. He came in and he said, Rashmi ma'am, jaldi theek ho jaiye, aapko more TV pe dance karna hai. Get up. Now see, only taking care and, you know, giving care buddies and things, that doesn't matter. At this time of our age, just 2 sentences of empathy, they matter a lot. And if any institution can't do that, then nothing is working for that institution. Then it's all a hoax. Sorry to say that, to use this language. The next thing which I want to say is that I don't think Mr. Swamijit would vouchsafe me if there is any institution which has a more TV kind of a thing. Do we have it? Is there any institution which has a more TV which comes on the screen and maybe have a lot of programs in that? CII is doing it. Okay, congratulations to CII. And I would also like to dance for you. And it keeps us totally engaged. I do write books, I write for newspapers. I am a practicing certified naturopath, but I have gained so much of knowledge by this Mo TV, because exercising and to make it short, best of doctors coming and giving us the understanding. Just let me tell you a real example. This elder has fallen, that elder has fallen. I will not fall, I am very sure. Because at least 10 times I have been trained by Mo TV how to do exercises and how to declutter my house so that I don't fall. So it is coming straight to me. So the idea is that we should benefit directly. We can keep talking a lot about it. We can make programs, we can make things. I'm not talking of dementia right now because that's not my area of work. But for an institution to be able to take care of an elder whose children are samudra par hain, saat samudra par, isse bada aur kya chahiye? Even whatever Imoha takes by way of taking me to the hospital and getting me admitted and everything, it is peanuts, my children say. You are getting such a lot of good care. The other thing, ladies and gentlemen, I would like to tell you is that only, of course, I hope only once, I got COVID. And my sister was in US. So I called up. As soon as you press the button, it is so relaxing to see we are on our way. And I was taken by an ambulance to one of the best hotels in Gurgaon. And I had the best room that I can think of. And personal care, and that was the strain 2 of, COVID. And when the whole city and the whole country was striving for a little bit of oxygen, I had the whole unit kept near me. I was just taken aback. How can one be given so much of good facility? Because you see, as somebody was saying that, there should be money. Money is a very important part. But what about the children of the people staying in India, the elderly people who have their children abroad? And they say, Mom, you don't think about money. Let the institution take as much, as long as you are taken care of. And during that COVID time, I wish I could show you on the screen the beautiful, interaction which was going on between my children and the institution. Imoha. Rashmi Auntie's blood pressure has gone this. Okay, she's a star. This is how it's gone out. Now she's all right. Now she's come out of the room. So my children are very, very, they're very relaxed. So, what I have to say is that any institution that deals with elderly people should make sure, from 2 points of view, and this is how I would like to conclude, from 2 points of views. One is that they should make sure that everything that they need, they get it immediately, which is very beautifully done by Emoha. And secondly, I have to write articles on loneliness. I just wrote it recently. Although I stay for 25 years and I don't get time to be lonely. So, to take care of that, we have more TV and we enjoy it every day. As and when we want to go to it, I dance on it, I speak, and I listen, and I get more knowledgeable. So, 3 cheers, even if other people don't cheer, I will. 3 cheers to my most happening Emoha. Hip hip.
Hooray. Yeah.
Hip hip.
Hooray.
Hip hip. Thank you.
A big round of applause for Emoha and Rashmi ji for sharing your story. It was very inspiring and great work. Like always, Soumyajit, you and your team are doing a great job. I think next we should move forward. Let's hear it from Dr. Asha Gaurishankar ji, who's also been a part of the Khayal community for so long. Why don't you talk a little bit about your journey as well, Asha ji?
Actually, I've just titled my... Thank you. I've titled my talk as well, Rewired and Reconnected, My Journey with Khayal Care. Namaste. I'm extremely happy to be here to share my journey with Khayal Care. And this community has truly touched my heart and has brought a new spark in my life. I joined Khayal in 2020. And I wasn't really very comfortable with using the technology because they said there was no app, but we had to join via WhatsApp and other things. But during the COVID, it was a boon in disguise. Little had I realized that Khayal would change my life so drastically. At that time, there used to be only 1 session per day around 5 p.m. And we would be eagerly waiting for it. But now there are 6 to 7 sessions and we have to select which one. In fact, my children tell me that you don't have any time for us. You can't even talk on the phone. My daughter is in US, so, there is so much of difference. And she says, you are so busy in your own life. You are so busy with Khayal that you just don't have time for us. But then I said, you are also busy with your life. And so at this stage of my life, I need to do something for myself also.
And now children should take appointment from you.
Well, actually it does happen at times, I don't pick up their phone. It's fine. So the 3 sessions which are very close to my heart are the cooking, technology, and there used to be a session on the old songs played on the guitar. It's not there anymore, but I used to love that and listen to it while I used to do my walk on the terrace. It was during COVID. Cooking, as you all know, you would say ladies love cooking. And so we would be given a theme and we would have to make a dish according to that theme. That's fine. But what was the challenge then? Showing it online. That was the biggest challenge. And it used to be very hilarious. Everything was visible except the dish. And the team there would tell us where should we place the camera. You won't believe we didn't know that there are 2 cameras, the front and the back. And they would really tell us where should we place the camera, where should the light come from, and how to really use it. Sometimes you would want to give up, but mind you, the team was very adamant. They would not let us give up. They were so patient, adamant in a very good way. But we felt at that time that we are so stupid, we don't even know how to put this camera. And I mean, our children, they are, even those who are 15, 20 years old, they are able to do it so well. But they would not let us give up. They would just tell us where we should place. And finally, we had to show our dish. And at that time, tears really came to my eyes. I was remembering when our children were toddlers, we would not give up. They would fall, we would make them stand, and then make them walk again. It was really heartwarming. Now, the technology sessions, we were taught, even how to use the phone, and you will be surprised. I thought I know how to use the phone. Obviously, everybody does. But there are so many features. And we were taught to use the phone, and not only iPhone or Android, both. Because both are different. Fortunately, I had both. My husband uses an Android, and when he would ask me anything, I would not be able to tell him. So I learned about both the phones. Even how to take a screenshot, we didn't know, to be honest. And WhatsApp, Gmail, online shopping, all these. And actually, you name a session, it was there. If it was not there, we would request, and we would get a session on that. And Chinmoy ji was so patient, and she would teach us so nicely. And she even taught us how to use Canva, make videos, and make collages, edit, and there was a whole new world open to us. Honestly, all these small lessons, they became a big help in my YouTube journey. And soon I was finding that I was loving this new learning. I would also remember how when I would teach the students, and I would tell them you can ask any number of times, but here I was asking the same thing over and over again, and then I realized what it would be like when you ask something many times. But today I feel connected, confident, and full of new energy. But CII is not just about learning, it is about belonging. They have online competitions, and that keeps us active and young at heart. Every event reminds me about the fun, friendship, and laughter, and it tells us that there is no age for it. Once actually my daughter had come from US, and my granddaughter who was 7, and there was a competition in July about emojis and all. So I thought, okay, I won't participate because I was very busy. So I told them, but my granddaughter was so excited. She said, no, you have to. I'll do your makeup. So actually the fun which we had at home, we cut out stars, put it on our eyes for that emoji which we made. And my husband is a very reserved person, but she made him sit, and she did all these mustaches and so many other things on his face. So it was such a fun time together in the family. And then I remember my trip with CII to Thailand in October 2023. And that was one of my favorite memories because I didn't have to do anything. Mostly we would be arranging the trip, but here, we didn't have to do anything. We were traveling together, sharing stories, exploring new places, laughing, and it was like a one big family together. In fact, we were pampered so much by the CII team. I really cannot tell you. And along this beautiful journey with CII, I discovered a new side of myself. With the newfound confidence of using technology and encouragement that CII gave me, in April 2025, I revived my YouTube channel, Maths with Asha Gauri Shankar. I had started this channel in 2018. I had uploaded just 1 or 2 videos because my son had done the shooting. And later on, I realized that he had not even uploaded them. They were not even live. I mean, he had recorded some live videos, but they were not there. That I discovered when I learnt about it. And you might wonder that at this age I'm starting my channel, but yes, I'm very happy to do so. And I would not like to tell my age. You can guess that. When I was young, if I was 16, I would say I'm 20. But now I don't, because people say, is umar mein? I mean, and I always wonder, umar ko kya hua hai? Matlab, aisa kaun si umar hai? Matlab, I don't know. So, what began as a small step has now become something beyond my imagination. It feels unreal sometimes that people from across the world are learning from me, smiling with me, and sharing my joy of mathematics. And to think it all began here with the support and motivation I received from the CII team. You know, actually I would not have been, I honestly mean it, I would not have been able to do it. I love teaching. And offline we don't get students. No matter how much I try, even I'm willing to teach free, but the students are not willing to learn. So when I found this platform, I was extremely happy. So in the past 28 days, I saw that my YouTube videos have reached more than 2.3 crore people, and this is totally unbelievable. I have never even written that word, though I am a mathematician, but I have never even seen how many zeros there are in it. Thank you, Khayal, for bringing light, joy, and togetherness into the lives of thousands of people. You are living truly up to your name. Khayal means, it's a Hindi word and it means taking care. And they are really taking care of thousands of people. I have so many friends online, and you know, we just talk on the phone, connect with them, and I never knew that we could make friends online. So I like to end with a few lines straight from my heart, dedicated to the spirit of Khayal. It's a small poem. Khayal care, where hearts unite. Khayal care, where hearts unite, turning grey days warm and bright, with smiles, love, and memories rare. Life feels richer with Khayal care. So here's to friendship, laughter and cheer, to every bond we've built right here. May Khayal's warmth forever stay in our hearts day after day. Thank you so much. Though I can go on, but I know there are other speakers and you have to go home. And generally people don't like to talk to elders because they go on and on and on forever. So thank you so much.
No, very inspiring story, Dr. Ashaji. You've been like a member from very early days, and a lot of inspiring stories, from all the members, both from MOHA and from Khayal members. Next, I would like to, ask Ms. Sagrika Mukherjee to, talk about her story as well, and then we'll move to Ms. Kamlaji as well. Yeah, please go on. No, you can just.
Yeah, good evening, friends. It's been very nice being here, listening to so many different viewpoints, and so much of information has been gathered. I came a little earlier, so I listened to the previous sessions also. So I'm so glad that something is being done for the senior citizens. But before I go into that, I would like to say a few things about myself and the situation in which I am in. Right. My husband and I both are teachers. He in physics and I was in history. So we led a very beautiful life. And we had planned to have a wonderful retired life. Around 2012, he was very good at singing and he had an elephantine memory. So nothing would escape him. He knew everything. We just had to tap him and he could give us all the information. And he couldn't sing a song which was his favorite. He forgot the words. So I got very worried and I got him tested, and that was the early stage of Alzheimer's. So we got down to treating him, and we came to, we lived in Patna at that time. So my son, who is in Gurgaon, he said, why don't you come over to Gurgaon, because it will be difficult for us to go over. We came to Gurgaon. It was not a bad time. I mean, he had forgotten, but he could still drive. And he could still sing. So I used to have the GPS with me, and we used to travel all over Gurgaon. Then COVID came, and that sort of completely, his memory disappeared. He couldn't recognize anybody, not even my children. He didn't know who I was. So that became a tough period when he was losing his control over his own organs, and many things developed. So by and by, each one of them we tried to control, and my son got me he said, my husband's friend, Dr. Anjan Mukherjee, he said, why should you feel so alone? Why don't you become a member of IMOHA? I said, IMOHA, I have never heard of IMOHA. He said, it is a home, in the reverse. It's IMOHA is a home, and you become a member. That was the best thing that happened to me. Because once I became a member of IMOHA, then I felt that somebody was there who was eager to help out in case of an emergency, because there is, as Rashmi was saying, there's an emergency button, and the moment you press it, immediately you get a response, and sure enough, they'll arrive in a short time with a medical practitioner and the ambulance and the oxygen. It happened to me 3 times when I had to call for emergency, twice for my husband and once for my neighbor who had a heart attack, and he was very serious, and IMOHA was agreed to help, and I am always grateful to them for that. Not only that, I needed an attendant because after he broke his arm, his shoulder, he couldn't do anything, nothing on his own. So IMOHA has been giving me a very good supply of attendants. I shouldn't say supply, I mean they delegated attendants. And the attendants are so good. I had one attendant who joined immediately after he broke his arm, and the other one who has come, he's now with us for the last 2.5 years, and he's such a gem of a person. A good training, and that is what IMOHA gives. Good training, and he can do everything. He's very loyal to my husband. I could come here only because of him. And all the time, IMOHA and even Shomujit, they take very good care. They're always tapping me. Are you okay? Is everything going well? Because my son and my daughter-in-law are both so busy with their work, I don't expect them to come over, and I feel very embarrassed if they are troubled too much. And they have a daughter whom they have to take care of. So this period, in fact, Shomujit came over to my house, and he was very keen that I should have a railing for my husband. And he personally took care, and he sent a railing, which of course I could not use because of some technical problem. And this is the kind of care that IMOHA gives. And when I joined IMOHA, certainly earlier, before I joined IMOHA, I used to feel a little left out because I was at home all by myself taking care of my husband. But once I joined IMOHA, then I didn't feel so lonely anymore. There was so much to do. IMOHA, as Rashmi was saying, we have the Mo TV, which starts at 8 o'clock in the morning and goes on till about 6:37 in the evening. There are 4 or 5 programs in between. So you can pick and choose. I, of course, can't attend all the Mo TV programs, but I look forward to the spiritual sessions, the session on Nature Club, and even on Literary Club. And of course, they have the Bollywood session where they ask the members to sing. And that becomes a very beautiful thing. Yes? Yeah. And the thing is that every day, the daughter, or the girl, lady who takes care of us, we have been allotted to her. She'll call me every single day and chat with me and want to know if anything has gone wrong. If there's any need, then we have a doctor in IMOHA, and you can have a session with the doctor. Dr. Bawa is very, very helpful. And he advises us. In case there is an emergency, he will tell me exactly when to go to a doctor, when to get an MRI done. So, it's a big help to be a part of IMOHA, which is a kind of you don't have to go and stay in any old age home, but within your own home, you have all the facilities which IMOHA is supplying. So, all the time we have to, we just take care of each other. And now I feel very although he has gone through a number of illnesses, all that we have overcome, today he is quite stable. Although his memory is totally, it's not there, he can't do, but then we do take care of him, and that is a beautiful period when now we can look at him. He smiles sometimes in a lucid moment he says a word which he may not have uttered for a long time, and suddenly he utters it, and both my attendant and I, both of us feel very joyous because he has uttered that word. So some things he may remember, and we are both eager to listen to those things. Every day we ask him, what is your name? He won't say. He'll just look around and he'll try to distract us. Suddenly one day he will say, Deb Mukherjee. And both of us will feel as if the day is made. He has mentioned his name. So that is the day-to-day things that go on. Every day is a challenge sometimes. But where senior citizens is concerned, my feeling is that longevity has increased. As we know, that senior citizens population will increase. And most of us, because of health care, we take care of ourselves. We are still capable of doing things. Maybe not physical work, but definitely we can contribute in many ways. So harnessing this huge workforce, I still call it a workforce, because there was a time when we were children, we had to get ready for some kind of a profession. Now we are coming from different professions, but we are open to doing all kinds of work. Even to be in charge of a creche for some time, to be in charge of a library for some time, to help out autistic children, to give them some help. In various fields, I always feel that senior citizens can be used to take care of those situations. Why waste that force? Why waste that entire, help that we can get from them? So I don't think it is senior citizens are to be pitied or anything. They can take care of themselves. If there is loneliness, it's in the mind. They have to get out of it. They have to have a positive outlook on life, because without a positive outlook, everybody can become a vegetable. So you start having sympathy for yourself. You die of, you wallow in self-pity, which is also not a good thing. So I think the society can come in and sort of, take charge, have some policy, frame some policy where senior citizens can also be harnessed. So it's on this note that I'd like to read out a few lines which I had recently seen. In twilight's calm, no storm remains, just softened light and gentler rains. The heart, once racing, learns to rest. Each breath a prayer, each day a guest. The mirror's lines, like rivers, show how far the soul has learned to flow. And though the years have thinned the flame, its glow is steady all the same. For age is not a closing door, but sunrise seen from life's far shore, where wisdom hums and laughter stays and peace walks hand in hand with days. Thank you.
Thank you, Ms. Sagarika ji. That was a very inspiring and wonderful story, and good job, IMOHA, once again, for doing such a wonderful work with the senior citizens. Next, Ms. Kamla ji, please, आपकी भी story हमें बताइए. It will be wonderful to hear you. Let us.
आदरणीय अतिथिगण, ख्याल परिवार के मेरे सभी साथियों और मेरी तरह ज़िंदगी को एक नया मौका देने वाले सभी वरिष्ठ नागरिक दोस्तों को मेरा सादर प्रणाम। मेरी उम्र 70 साल है, 70+ है और मैं हाउसवाइफ हूँ। मेरी 2 बेटियाँ, एक बेटा है जो इस समय में वो बाहर रहता है और मैं अकेली रहती हूँ। 2016 में मेरे हस्बैंड का अचानक दुर्घटना में एक्सीडेंट हो गया और उनकी डेथ हो गई। तो उसके बाद से मैं बहुत ज़्यादा डिप्रेशन में रहने लग गई, दुखी और परेशान थी। तो अचानक एक दिन मोबाइल पे ऐप में मुझे ख्याल का देखा, तो मैंने उसको ज्वाइन किया। तो आज पूरे 5 साल हो गया मुझे उसको ज्वाइन किए हुए और मुझे बहुत अकेलापन महसूस होता था। तो फिर मैंने ये आज 5 साल पूरे हो गए इसको ज्वाइन किए हुए मेरे को। और नहीं, ख्याल में तरह तरह के इवेंट्स हैं, उसमें तंबोला, गेम्स और इवेंट, ये सारे क्या उसको आर्ट्स, सिंगिंग, म्यूज़िक, डांसिंग सारे। और मुझे सिंगिंग का बहुत ज़्यादा शौक़ है और सिंगिंग का कोई भी प्रोग्राम मैं मिस नहीं करती और हर जगह उसमें भाग लेती हूँ। और उसमें जो मेरे को खुशी मिलती है इवेंट्स में भाग लेने के लिए, मैं उसको बयान नहीं कर सकती बिल्कुल भी। बहुत अच्छा लगता है मेरे को उसमें। और ख्याल ग्रुप का भी सभी स्टाफ बहुत ही अच्छा और बहुत ही मददगार हैं। जब भी मेरा कोई सवाल होता है उनसे, तो उन बहुत प्यार से और बड़े अच्छे से उसका जवाब देते हैं। मेरी तरह बहुत से सीनियर सिटीजन इसी ग्रुप में जुड़े हैं और वो सभी बहुत खुश हैं। और मेरे को देख के, मेरे से प्रेरित होकर मेरी सिस्टर, मेरी फ्रेंड्स ने भी इसको ज्वाइन किया है और वो सभी बहुत खुश हैं सब लोग। ख्याल ने हम सभी को एक दूसरे से जोड़ के रखा हुआ है। ये ख्याल सिर्फ एक ऐप ही नहीं है, बल्कि एक परिवार है, हमारा एक परिवार। और वाकई सही में ख्याल ने इतना हमारा ख्याल किया और परिवार की तरह हमें रखा हुआ, उन्होंने इतना ध्यान रखते हैं हमारे। और मेरे ज़िंदगी के अकेलेपन को उन्होंने मेरा दूर किया है। आज उस मन से जुड़ के बहुत खुश हूँ। मेरे बच्चे भी मुझसे अब उनको है कि हमारी मम्मी बहुत इसमें बिज़ी रहती है, बहुत बिज़ी रखा हुआ है ख्याल वालों ने हमारे को इसमें बहुत खुश और ख्याल रखा हुआ है हमारे साथ। और अब तो 50 भी सीनियर सिटीजन का बहुत अच्छा वो भी आ गया, उसमें और भी कंपटीशन में अच्छा लग रहा है। तो मैं अपने तहे दिल से ख्याल का और ख्याल के पूरे स्टाफ का शुक्रिया करती हूँ और आप सबका भी धन्यवाद, बहुत बहुत शुक्रिया। आज मैं एक लाइन और कह सकती हूँ कि कभी कभी मेरे दिल में ख्याल आता है कि ख्याल आपको बनाया गया हमारे लिए।
And that is really true. It is, I'm so grateful to Mr. Himanshu Jain and his other co-founder, that how did they think about it? People always think of youngsters. How did they think of people like us, who are so senior? And then, the other thing is even thinking of the award, 50 above 50.
So I would like to answer that for you. Khayal is an ode to our parents, and all of you, all the elderly are like our parents. While I was in US, I would always think of how we'll be able to take care of our parents. तभी ये ख्याल आया और हमने ये चालू किया, and that is how the genesis of Khayal started. And 50 above 50 is like a passion project. So a lot of people talked about ikigai and giving purpose in life, and 50 above 50 is like India's senior superstar competition that we have started this year, where more than 25,000 seniors participated in various categories like singing, dancing, arts, and all of those. 15th and 16th ko we have a very large event happening in Mumbai at Nesco grounds. And I think more and more people can participate and, make your passion your purpose in life, and that is your ikigai, Thanks.
हिमांशु सर, मैं एक चीज़ और बोलना चाहती हूँ। मैंने जब डिप्रेशन हुआ था ना, मैंने सारी अपनी मेडिसिन उस टाइम छोड़ी जब ये मैंने ख्याल ज्वाइन किया। आज भी एक्सपायरी डेट की मैंने रखी हुई है इसी याद में कि मुझे याद दिलाते हैं कि मैंने जब से ख्याल ज्वाइन किया है तब से मैंने दवाइयाँ बिल्कुल छोड़ दी हैं।
थैंक यू।
So, I think we all should give. Yes, Rashmi Aunty. Please.
हमारी ये आदत है कि जब कोई शेर बोलता है तो हम उसका जवाब जरूर देते हैं। तो एक शेर प्रस्तुत है जो मैंने अभी भी लिखा है आपके सामने। बहुत कोशिश की जिंदगी से मिलने की, बहुत कोशिश की ज़िंदगी से मिलने की, मोह तुम क्या आए, ज़िंदगी से मोह हो गया।
क्या बात है। I think all of the elders on the stage deserve a very, very big round of applause. Can you give them a big round of applause, guys? I think it's like a celebratory noise. But you know, it gives me goosebumps to hear all the wonderful stories from Kamla ji and Asha ji and my dearest Rashmi Aunty and Sagarika Aunty. I can tell you that when Rashmi Aunty told you the story about the COVID hospital, what she didn't tell you, मैं आपको बताता हूँ. What she didn't tell you is that when she was very sick, she went to the outside of the room और जितने भी nurses थे, उन nurses से dance करा रही थी. Because कह रहे थे ये nurses इतने थक गए हैं, let me entertain them also. So no, and that is what I would like to conclude in this session by saying that this is not a one-way road. ख्याल का ख्याल, इमोहा से मोह. My dear friend Ashish is sitting here. Samarth ka Samarth. You know, we are all there. Neha is here. Epoch se Pyar. These are all organizations which are built with a lot of love and care. And these organizations can't go to the next level without such wonderful elders and the blessings that you are sharing with us. Sagarika Aunty ki story, I know her story very well. How she is a champion taking care of her family, her husband. I met her the other day at Artemis Hospital, you know, with the Imoha, you know, the carer, and taking care of uncle in the new geriatric facility by Dr. Prasoon, a brand new facility that has got created at Artemis Hospital. This is an evolving story, ladies and gentlemen, by players, whether it is Imoha, whether it is Khyal, whether it is Epoch, Samarth, these are all organizations trying to do our best, and our motivation is to be able to build something that will outlive us, that will be able to provide care for the wonderful elders who are on the stage and millions of elders out there, जिनकी ज़िंदगी अगर एक छोटी सी, you know, 1 degree more if we can improve their lives, it will be so much more better. Today morning, I think a lot of people spoke about becoming a senior. तो बहुत अच्छी बात है senior हो गए. I don't think we should change the word senior. I don't think we should change the word old age. बहुत अच्छी बात है. We should be proud of saying it's a senior. So I have a point to discuss and go back to the CII team and say that we should be very proud. We should not change the word old age home. We should not change the word senior. This is a very good thing. On the contrary, we should celebrate the fact this is a senior. We should celebrate the fact that this is the time abhi to party shuru hui hai. So how do we make sure that this term is not changed, but the feelings for the term should be changed? So absolutely. So no need for any Z plus or X plus. This is absolutely fine. Being senior is the best part of life. I am looking forward to becoming a senior 6-7 years from now, and therefore looking forward to how this is the best part, the golden part of the years. And for those who are not seniors, if you can do a little bit to bring happiness and khushiyan and khyal and moh to the wonderful elders like them in the stage, zindagi aapki khushhali वैसे ही हो जाएगी. Thank you so much. Thank you. I think one big round of applause for the elders on the stage.
Thank you, esteemed panelists and moderators. एक मिनट मैम, just a photograph. I think they're wanting to take a group photograph. Requesting Mr. Himanshu Jain to please felicitate our wonderful storytellers.
Thank you.
Thank you so much.
And they come from this side. Yes, sir. हाँ हाँ मिलेगी ना, चाय मिलेगी, क्यों नहीं मिलेगी?
Thank you so much. We'll now start with our final panel discussion for the day, Connected Seniors, Digital Literacy, Inclusion and Helplines. This session inclusive digital world for seniors and empower them with confidence. To moderate the session, I invite Mr. Soumyajit Roy, CEO and co-founder Imoha. Welcome back, sir. I'd like to call upon the panelist, Mr. Himanshu Jain, co-chairman CII Committee on Senior Care and founder and CEO, Khayal. Thanks. Welcome back, sir. Ms. Deval Deliwala, co-founder and CEO, Get Set Up. Mr. Vishal Gondal, CEO, GeoQI. Mr. Ashish Gupta, founder and managing director, Samarth. Dr. Reema Nadik, Director and Group CEO, Columbia Pacific Communities, Senior Shield and Kites Senior Care. And Mr. Sandesh R. Kadabam, Managing Director, Kadabam's Group. Thank you, panelists. Over to Mr. Roy to moderate the session.
Thank you. I think after the beautiful session that we had last session, and as the last session before we close, I am reminded in 2016 when I was with Antara Senior Living of this beautiful discussion that happened with Dr. Shabnam Singh, who has always championed the cause of CII and health. And she told me that, you know, Soumyajit, I have a task for you. And this task was to set up what today has become the CII Senior Care Conclave. So it feels very, very privileged to be part of this conclave and with a very, very august audience. What makes it even more extra special is that my dad is here. So 3 cheers to you, Dad, for being here. He's a active caretaker, takes care of my mom. And one of the reasons why I said कि industry के बड़े-बड़े लोग बहुत कुछ बोल रहे हैं, आप एक बार आके सुन लो. You know, maybe you can also give some advice to everybody. Okay, so this is a very super special session. It's a session about a topic which is very important. You know, we have 340 million senior citizens. Is that fact correct? How many of you think it's correct? 340 million senior citizens. Is that correct? That's correct. That's the number is 2040. Those are 40 mein, we will have 340 million senior citizens. And that's the same number of population of the country when we were independent, 1947. Imagine the same number of senior citizens just 20-25 years from now. The shocking thing is that not more than about 15% of our senior citizens today are digitally literate, which means they are included, which means they are part of a technology system. I think Sagarika auntie, Rashmi auntie, and everybody on the dais talked about how their lives changed with technology, with access, with inclusion. And therefore, the ability for us to see how instead of 50% of the normal population being internet penetrated, why is it that only 15% having access to technology? Technology has a superpower to be able to do so many things. I don't want to talk about the various things that are happening in the industry. We have panel members who will do that. But to begin with, I must say that we'll pick up 3 important topics. One is this whole thing about digital inclusion and how do we bring in more and more inclusion and what are the bottlenecks? Because, you know, many of you, how many of you have AI on your apps? Raise your hand. Some AI app on your app? Very nice. So, how many of you had AI apps 6 months back? Much fewer, right? So, chances are every passing months, what technology you have on your app will also evolve. It's also change. And therefore, the speed at which things are moving, whether it's AI, whether it is sensors, whether it's technology, I think it's important to be able to build a model, build a country where all of us can see a powerful India with elders who are more connected. Would we not want that to happen? Because there is so much more that can happen with that. So my question to begin with to Himanshu and Dr. Rima, all of you have heard about Himanshu and the fantastic work he's doing with Khyal. Dr. Rima again is doing fabulous work being part of KITES, not just part of the Columbia Pacific communities, but also a Senior Shield, right? Senior Shield, which is such a fabulous app which brings together safety and various features. So question to Dr. Rima and Himanshu is, in your experience, what have you seen as blockers? As in Himanshu has seen a lot high user adoption. What do you think are blockers that have prevented elders to be able to access technology systems better? And what have you done to be able to, you know, kind of remove the blocks and increase acceptance of technology? Go ahead.
This is a learning I would like to share, for being in healthcare for almost more than a decade now. Even when, my last startup, which I was building, Diabito, which was, a diabetes therapeutics company, which was then acquired by Livongo, we saw that accessibility became a very big challenge. And accessibility is for all. It's not only for the aging population, it is also for us as well. And if you see, devices around us have a very boring design. So we were trying to figure out, how to create medical devices which can be much more human friendly, which can be, accessed by people even with motor disabilities and stuff like that. At Khyal, what we have seen is that accessibility, from the standpoint of mobile phone as a technology, because I think the most powerful device that anybody has today is their mobile phone. And today, every senior has a mobile phone. Everybody is on WhatsApp, everybody is on YouTube, Facebook, and so on and so forth. These are places where they learn stuff. So, of course, content becomes a very large part of how you try to create awareness around various things. So, the blockers have always been from the standpoint of creating the right awareness, the acceptance, and then adherence. So these are the three major, I would say, hurdles to cross for any organization. Because the moment you create awareness, once people are aware, only then they will be able to adhere. During the time of diabetes, I remember, back in 2012, nobody would understand diabetes. People used to think कि अरे मीठा खाने से diabetes होता है. And still today, I think a lot of awareness is required. But what is happening is that through the digital age, people are learning so much. Like there are so many content channels like Glucose Goddess and so many others who are inspiring people to live life in the most fullest form. And which is why I feel that because of the information which is out there, content will create a very big channel for us to be able to create that awareness, and automatically the adherence will come in, and then people will want to start using different technology, different devices, different new offerings which are coming. So it is just gonna help everyone.
So you feel it's more that like elders who've come into various age tech platforms, you feel it was awareness which prevented them to come in?
No, so awareness is required for them to come in. And what prevented them to come, I think it was, the dignity factor. Because what happens is that when they go to their people in their own homes, people make fun of them. कि अरे मुझे आपको इतनी सी छोटी सी चीज़ नहीं पता. So it's actually the society to be blamed for. कि लोग उनका मजाक नहीं बनाना चाहिए. They should, openly teach them things. Like that's one of the things that we do at Khayal to help the elderly with everything.
Technology.
Yeah.
Dr. Rima, what do you think?
Yeah, I think a very, very, very valid to start this session question. And thank you, Delhi, for giving me the gift of 20 sneezes that I got when I got from your airport to here. There are three things in medical, in technology, if we are looking at it. It's just not the app, but the technology, the med tech part, There is data that needs to enter. Then there is an app or a solution or a platform that is analyzing it. And then on the other end are the people who need to respond to whatever analysis has happened. So very important that the users, who are the seniors we are looking at, see these three components with seamless flow of these information around. There has to be, how does the data enter this particular platform? It has to be automated, because as humans, we will not be motivated to put in the data. So what is that technology that we create to put in the data into this platform? How well is the platform and how friendly it is? How easy? How is the UX? How is the user experience of this particular data? Is this intimidating for the people who are supposed to be using it? So that is the intimidation, or the because all the elders who are in our family, they have taught us. And when times come for them to learn certain things, they feel a little hesitance. So how do we motivate them to just keep learning? That is another part. And then after this, all these exercises happen, who is there to respond on the other side? Do we get the right kind of response and the support? So these three components has to be seamlessly planned when we talk about technology. Another thing that we need to keep in mind again is the technology nowadays. We are at a stage where elders are adjusting themselves to the existing technology. The technology is not being created for them. So I think we all need to learn to see that what is that this particular age group, what is ease for them to use it, what is their requirement, are we making anything redundant? Is this usable by them? Are they accepting it? And very, very important, are they able to afford it? Because we don't have to talk about certain sections of the society, but we need to talk about, going into the rural India also. And as you spoke about the, penetration of technology into rural India too. I think it is only 15% of the senior population who is having access to technology or smartphones. The smartphones, again, they get it, the seniors in the family get, which is hand-me-downs from the children. Not enough RAM, when they have to talk about increasing the speed or updation of the apps don't happen. So how light, how in the back end the logics are created for these platforms and technologies, how easy it is for the elders to accept it. So it has to be made absolutely, the elders should not feel intimidated by technology, but happy to accept it as partners, because whatever we do, technology has to be adopted. It has to become part of our life, because that is how it is going to become easier for everyone. It is an integral part of life, which is going to penetrate more and more. I remember the day when the ChatGPT came out, I was actually scared, and I thought about the Terminator movie. The last one, I was very scared. I said, what is the world going to? But, the reality is, we can't run away from technology. We only have to adopt it. And I think it's a good reason. I think Neha will also, agree with me. Neural plasticity is something that we need to keep working on, and it is an ongoing process. New learnings that come our way, I think it is a good thing to the technology to evolve, but let's us also creators of the technology to ensure and acknowledge the age which is going to be using it, making it friendly, making it more acceptable, making it affordable, and making it sure that it is lighter so that we don't require huge bandwidths for us to work on our apps.
So relevant points. I think what both Himanshu and Dr. Seema are talking about is very relevant, that it's not, technology is not, technology is just a tool. How have we designed the systems? How have we thought through the interface? And interface today is becoming a very large field, whether it's the UI, whether it's the voice, whether it's the response systems. Collectively, it is going to make the difference. I remember Rashmi Aunty was talking about the fact that button daba do, immediately somebody will come in. Somewhere the trust that will it work? Kuch problem to nahi ho jayegi. Hopefully the person who will come in, is he trustable? So it's a loop that is far beyond just technology and so on. Having understood a little bit more about accessibility, let's shift gears and look at, I would say, the possibilities, because tech has such a fabulous role to play. The fact that it can save lives, it can monitor health, it can give us predictions, it can, literally be able to manage a care plan far better than human beings can do. And in that respect, with Vishal, Ashish and Sandesh, three gentlemen who are working cutting edge in this field, I would like to start with Ashish. Ashish obviously is doing fabulous work in Samarth, again a tier 1 organization, taking care of elders across the country. Ashish, paint the road, you've been a consultant in your past, paint the road on how technology can really offer a scalable solution. As an access is one part of it. ठीक है, 15% है, 50 भी हो जाएगा. But क्यों करें? Why is technology so important, particularly in the age tech and elderly segment?
Thank you. Thanks, Swamijit. I think this is a question which keeps a lot of us awake. Because we want to do much more. We want to reach out and support and help and make it worthwhile for a lot more people. But we know we can't do it without technology. There's only so much we can do. But I'll ask a little bit of an uncomfortable question as well, which I think we must also address. And part of this is coming from our own experience now of helping and supporting elderly, age at their own home in now 200 cities. Also engaging with thousands of others in the context of the Elder Line, which we ran in 3 states for the government. The question is, who are we building for? We've all talked about, and in the earlier sessions also about technology can do this, can do that. A lot of the elder tech today is actually designed, I would say, not for the elderly, but for their families, their caregivers, for hospitals, for insurers, right? So we build monitoring dashboards, which are for people like me, my parents, so anxious relatives who want to know about this. Data analytics platform, who are they for? For healthcare providers. Risk management tools, who are they for? For insurers. So while they bring peace of mind to a set of people, are they really bringing the joy and peace of mind to who they are supposed to help, which are the elderly? Because what happens in the process is that many times seniors become, passive recipients of these tools. So I think, I go back to what we have believed very strongly in, which is everything that we do needs to somehow connect to the quality of life, right? And how do you describe quality of life? Our simple formula is, 1, 2, 3 of quality of life is most elderly would like to have, one wish, which is stay independent. They want to address 2 worries, which are around health and money. And they want to have 3 joys, which are, about having people to talk to, places to go to, and a sense of purpose, which is, to make them feel needed. So every piece of technology, digitalization that we do, we should ask ourselves, is it helping fulfill the wish? Is it helping address the worry? Is it helping bring joy? Any of the 3 joys. I think that is what, first of all, the purpose should be. The second is our, fundamental belief that technology and touch have to go together. Right. I think, Himanshu mentioned a few things about what stops people from leveraging or using technology. Just having technology in front is not enough. Right. Somebody has to make it possible. Somebody has to have the patience to help people adopt and understand. And I think there we have to make sure that the technology is being delivered with empathy. And some of that empathy needs human touch. And so that's the other thing, I think, which you can think about as a blocker or what will make it happen. And I think increasingly as we go forward around different modes of technology, we'll have to solve for this. That where is the empathy and where is the touch that is coming through. I'll give you an example of what can happen. So we run these multi-activity centers for elderly into, districts in Jharkhand. And this is a community-led initiative where people come and there are, individuals who may come from the senior community. There are retired teachers, there are retired professionals, and there are also young volunteers, young, students, etc., who are part of that. In that context, we've been able to, with thousands of people, introduce technology in a way which comes supported with, empathy, where there are people who are, as was said earlier, have the patience to, help with making use of it and adopted it. And I think there are consistently similar lessons if you think about the way ahead from countries who you think would be ahead of us, right? So Singapore had launched an initiative where they said, look, let's give tablets to people and let's give devices to people. What really made it work was that behind it also there were people, there were volunteers who were helping elderly make sense of it, understand it, use it. So I think those are some of the things which we will have to build in as we think of new technology, in my view.
Thanks, Ashish. I think the point you touched about tech with empathy, I strongly agree with that. I think just creating an app is not the answer, or just creating a sensor obviously is not the answer. But how do we stitch the services in a way which is able to circle back is really something that goes way beyond. And that brings me to Vishal, somebody who's created Goki. Am I correctly pronouncing it, Goki? For those of you who don't know, these are, sensors which can really detect a host of things which can make your home more safe, make your, movements much more safer. So Vishal, tell us how an elder should think of something like Goki and what are the kind of possibilities that technology can offer for them?
So I would say that, technology always leapfrogs. We are currently, the wearables is already now 8-10-year-old technology. If you see step counting or remote patient monitoring and everything we are using today, Apple Watch, these are all becoming legacy technologies already. What is happening is, just think about India. Aaj se 10-15 saal pehle, we did not have broadband. Everybody was saying, how will you use broadband? We never had broadband. We directly jumped to 5G. And today, everybody on the street is streaming video with complete comfort. They have no problems at all. So I believe that, while we are thinking of, seniors or elders, we are missing that technology is not going to be incremental. It is going to completely leapfrog. And what is going to happen is, currently the entire world is focused not on biomarkers. Pehle tha steps karo, itna pani piyo, have your HbA1c itna, blood pressure itna. People were all obsessed with biomarkers. That is now moving to, can this reverse my age? what do all these biomarkers finally translate into? Can I become clinically younger? So all the science around wearables, and the minute you combine wearables with genomics, with AI and predictive, and then it is about hyper personalization. So the next thing which we are focused on is no longer the one size fits all model, which largely medicine is, right? कोई एक गोली, कोई आधी खा रहा है, कोई पूरी खा रहा है, पर सब लोग वही गोली खा रहे हैं, which is not bad, but going forward, it is going to be about personalization. So the challenge, what I want to really do is, I think we have to redefine what is aging in our own minds. Think about it. In 1940s and 50s, average lifespan of India was 55 years old. People were at 55 was considered end of life. Today, that number is already at 75. And I believe with almost certainty that a lot of people who are still under the age of 40, very high chance that you're going to live over 100. Absolutely no doubt about it. And people who are already taking care of their health, who are in their 60s and 70s, there is no reason you cannot touch 80 or 90, because if you see largely issues are all surrounding lifestyle, which is their diet, their physical exercise, mental cognition, etc., which can be very easily taken care of. So what I really believe is, that India has always surprised the whole world. Look at UPI. Who could imagine that we will be the biggest market for digital payments? Nobody could think about it, right? And what changed? It was not technology. What was the number one reason why digital payments were accepted in India? There was one word called cashback. हर आदमी ने बोला कि आपको cashback मिल रहा है, आप ये use करो, and you got a cashback. So what worked is incentivization. So we need to figure out how do you create incentive models which are aligned to what we really want. Currently, the incentive models are actually not aligned. The entire model is focused on sickness. आप ये एज हो गई तो आपकी नी रिप्लेस हो जाएगी, फिर हिप रिप्लेस हो जाएगा, फिर किडनी भी रिप्लेस कर देंगे, फिर डायलिसिस में भी डाल देंगे. दैट इज नॉट एजिंग. Currently, a lot of people के लिए एजिंग ये हो गया है कि as you age, you are replacing every body part and just extending your life, but that is a very poor quality of life. The way I think about aging is that how do you make sure that you are active even at 80, even at 90, you have all the right biomarkers, and then you keep monitoring and keep managing it. So I think that's really where technology is going. And from wearables perspective, we are now going to move from wearables to implants. So already people are wearing CGM devices, which are, implanted in your body. Soon, Bluetooth आपके tooth के अंदर ही implant हो जाएगा. तो data बहुत हो जाएगा. Data की problem ही नहीं है. Problem is, how do you create the incentive structure for people to act? And I want to just end by saying this, that right now what is also lacking in India is research. जब तक हम लोग research यहाँ नहीं करेंगे, we cannot think of solutions. We are still now, the amount of research happening here is very, very low in all of these things. We are still importing a lot of the things, which is not going to work. And on the research side, we were lucky enough that we were able to partner with 2 institutes. So we are working with Ashoka Institute of Biosciences here. We are working with IIT Bombay. And we are actually doing clinical research on aging. So as we speak, our research is ongoing where we are going to do 10 to 20 years age reversal in people between the age of 50 to 80. So this is right now research happening, and we are running clinical studies in Bombay, in Jaipur, in Delhi, and we will be running these studies till 2030. And 2030 tak, there will be solutions which will be talking about not management, it's about active age reversal itself. So that's really where this entire technology is going. And if you hear of people like Elon Musk, after getting his $1 trillion package, the only next thing he wants to do is never die, so that he can enjoy that money.
I don't know if that is a good idea. I think at some point of time you need to move on. But would love to hear from you. And Sandesh, given that you work in a space which is very special to my heart, mental wellness, and the crazy possibilities technology can do in this space, Paint us a picture of how, we keep discussing about like what Vishal was just telling, our body parts, and kidney and liver and all of that, but we forget that the most important, the top of the engine is our brain and what we are doing with it. So how can technology play a role, and what can technology enable to be able to give better emotional wellness for our elders?
Super. Thank you, Somijit. I think many of you might not be familiar with what we do. I run a facility called Kadabams. Surprisingly or interestingly, we are a 3-decade-old organization in managed care. So everything that we have done, and I'm going to get into what we've done with digital innovation for us, the advantage and challenges were beautiful. We didn't have a lot of solutions for us available. There is an industry as senior care today under CII. So everything that we did was really from the point of necessity, because we house a little under 700 individuals in our residential rehabilitation centers. And in the last decade, we would have touched upon about 110 to 120,000 lives. And these are complex, psychiatric conditions, intellectual disability, comes with it the degenerative conditions, the senior care that we've spoken about. But there's also a very interesting population. We're talking about 11% of India with diagnosed mental health conditions, and in which 7% of them are with complex psychiatric illnesses. So how easy or difficult is it to manage a person with schizophrenia or bipolar or a condition like OCD, which is chronic and as they age? And I promise you, you all as senior care providers, in the next few years, this is the conversation you are going to have. The spectrum is going to widen beyond dementia and Alzheimer's. Dementia, Alzheimer's, I'm sure there is work that's happening. There's one of those that got picked up in our mental health as a space. Coincidentally, I was telling the CII folks that when is the time that we'll have mental health industry representation? We're not still an industry there as yet. So coming back to it, how we solved it is, if we could solve the service delivery, and so a lot of these innovation came along from the doctor and the clinician standpoint. As Dr. Reema was mentioning, the information going in that we are able to interpret and then being able to analyze, and especially in a chronic condition, help ourselves in the delivery of care. Because they may stay with us today, they may get reintegrated into mainstream society, they may come back into our services, or they may come back in a position that they need to be cared for relatively longer period of time. Now, how do you keep this whole journey and the touch point tracked down? So this was all about digital. And luckily enough, we had a very enterprising clinician like Dr. Reema, who said, my medical director said, I'm dropping my pen today in 2017, and if I can adopt typing, I'm sure the rest of you all as younger clinicians can do so. So that was a great adoption. That challenge I think I didn't go through. But in the last 2 years, what we've moved to is to building doctor assistant. Because we were able to then bring in about an ambient conversation like this, and if that can go into doctor notes, and then translate all of this knowledge into patient assistant. You all can try our mental health deep agent. I'm not confident to tell you that is my physical health deep agent as well. But what we've done in physical health is we've been able to take down the motion sensor, track down, can you use your phone to be able to track your gait analysis, to being able to monitor and give you goals that you can go the whole journey with. Again, all of our ethos are around behavioral health, mental health. Now taking that into physical health rehabilitation, and our senior living facility launches when I go back day after tomorrow. So that's our first active senior aging community. But I think all of our ethos will be around managed care and rehabilitation. And to me, if you can give every individual access to the right resource in the right form at the right time, I think the whole journey is beautiful. I mean, I can relate to a lot of things that we're talking about, and I'm new. I know you understand that I'm new in the Asli fraternity as well. So it's this journey that has helped us. And then one last thing is, when somebody calls, can there be a human answering the phone? So today we answer close to about 20,000 phone calls on our helplines, and each of it being dedicated. So you're available, you're able to communicate, and then you're able to deliver services and track down the whole journey. I think that's been how technology positioned for service delivery has made it possible for us to be where we are today, and I think we're still learning.
So nice. So I'll, before I open the round for any questions from the audience, if I could request every panelist to say one wish list in one line on what you think can leapfrog the accessibility technology paradigm. How can we do one thing, or what you can do as one thing, which can really change the game? And 2 years from now, when we come for this summit, we'll say, उस दिन जो हमारी एक पैनल डिस्कशन हुई थी, उसमें जो हमने बोला था, हमने करके दिखाया.
I think I answered this before also for you, but I think content is the way forward to create awareness, because the more you create content, and people will automatically know, and they will start adhering. Yeah.
Super. Content. So Himanshu goes for content.
So I would say assessment, right? We at a national scale have to do assessment of people across key parameters, because what is happening is people are not testing themselves, and suddenly one fine day they get a heart attack, one fine day they get a stroke. So if there is a proper program of assessment and then using AI tools, we can predict risk. अगर लोगों को पता ही नहीं है उनको risk क्या है, तो how will you treat them? So right now it's completely reactive. And the first step is to create a policy for national assessment of every citizen.
Very good point. Dr. Rima?
We should create content for that.
Content is going to be commoditized. Content is not.
Yeah, I think technology has to keep up with the age. Every 5 years, we are going to be having different set of seniors. The 60 of today is not going to be the 60 of 5 years later. They're going to be more advanced. So I think technology has to be agile. It has to be simple to adapt. Very important for us to keep up with the new lifestyle of the seniors that they demand. Yeah, I think for technology not to die, it has to be quickly innovative. I think all of us are working in a space right now, which is just the beginning of our journey, and the work is going to be WIP for a pretty long period of time, I think.
Thank you. Sandesh.
So I think the key is going to be implementation of our policies, implementation of the product. I think that's going to be the key in how it is done. We have it all in our planning docs. The governments have it, the commissions have it, but then the key is in how well it can be implemented, and I would love to see a country that adapts that.
Ashish.
Yeah. So, I think we all will do what we have to do. Given that we are here and I can see Joy here, I think we should take advantage of the fact that we are at CII forum and, ask. We have some, at least I have, some suggestions or a couple of asks. So one, I think we've talked about technology, and there is so much innovation happening. Products are being created, services, there is infrastructure which is using that. I think there is value in developing what may be a subtle operating system for elderly, which is designed with elderly for elderly, right? From interfaces to interoperability, I think that is one big thing. Because each one of us, or different organizations in their own area, are trying to figure this out. Think about Android for elderly. Yeah. The second, and I'm sort of bringing in the the Samaj, Sarkar, or Bazaar into it a little bit, because that's what CII can do very well. Is also we talked about what will make technology usable. One part is the OS and the interface, etc. The second is what will attach touch to it. And I think there is an opportunity to look at some sort of a national force, call it
tech mitra or whatever it is, which are community-led forces which help people adopt the different technologies, different aspects which are coming in.
So I think I'll just summarize very quickly before we open up for questions, Rashmi Aunty, definitely. I'll go for the word convergence. I think there is tremendous possibilities on where we are sitting today. We are seeing new range of IoT sensors. We are seeing sensors which are not even wearable, but which is able to trace what is happening in the home. We are seeing so much medical technologies come up. I was watching some of the things happening on the first floor. The ability to converge hospitals, clinics, doctors, what is happening inside the home, apply AI on the whole algorithm, at the same time being able to direct that carer who's on the bedside to give him or her contextual information at the right time is very, very important. So how do you make it sundar, sasta and still tikau? So it doesn't be so expensive or so difficult that you can't do anything about it. At the same time, I think one of you mentioned this word, accessibility. So accessibility, availability, affordability, very, very important paradigms for it. Otherwise, we'll keep on doing a lot of innovation, but that innovation will not see adoption. In some of the examples in how KL has seen adoption or for whatever it is worth, how Emoha got adopted is because we kind of stitched the technology with the human being. I don't think any of our technology would work if the Emoha daughter would not be there. So these connections in some ways really make it go to the next level. Last but not the least, I think the point about the data moving to longitudinal data, the data moving to information, to knowledge, to wisdom is what probably families, sons and daughters are looking for. They're not looking for the data points. They're looking for actionables that can happen, which can bring better care outcomes. So on that note, would like to thank all my esteemed panel members. Fabulous insights. Next year when we meet, hopefully some of us will have Bluetooth tooth and wearable, speakers and microphones, and be collectively able to do a better job of taking care of elders. But we'll take one or two questions. Rashmi Aunty.
Ladies and gentlemen, first of all, I'm very happy that after today I get reassured that I'm in very good hands as a senior. And secondly, what I would like to tell you, inform you as a senior of 75 years, we do not need much, but we need it on time. It's basically that way. And also, when it comes to technology, there are some things which really troubles us. इसके लिए 1 डायल करिए, उसके लिए 2 डायल करिए, उसके लिए 3 डायल करिए. I mean, it is quite, distressing to be doing that. And as far as technology is concerned, I can save you and say that we do not need too much of it too, right? Because our generation gets kind of, awed by so much of technology. We would like to have it only the amount that we really need for us to carry on with our lives. So too much of technology, I don't think. And in Emoha, we have 2 gentlemen. Any problem I have, I talk to them. They come share the screen with me on my laptop and they solve it out for me. All these little things. And what I would also like to say is that today in front of everybody, I commit that I have been counseling for the last 30 years. And I would be too glad to counsel for anybody so that we nip the thing in the bud. And I would like to give my services to both these institutions complimentary.
Rashmi, always an absolute celebrity. Thank you so much for gracing us. Dad wants to say something.
Well, I'm Shomajit's father, but as a senior person, I've just touched 79 this October. And I have been hearing the session right from the beginning, from the morning, and looking into what are the problems what the elders normally faces. To give me a background, I'm basically an engineer by profession and worked at the very senior levels of president, CEO, and executive director of many companies. But in our time, as you know, the salaries were very low. So when we retired, the corpus that we had, and we had put it in the banks, and whatever the interest we get from that is so low that it is very difficult to manage. I have a gem of a son, so for me it's okay, no problem. Because what happened is, overall corpus that we get in hand, and then we want to spend money on all the health issues. My wife is an Alzheimer's patient. Last 15 years I had been taking care. I was working as an executive director of a company, JCBL, which is an automobile company, having 5% profit share of the company, but I left that company only because of her. When I read through Alzheimer's and I understood that what dangerous disease it is. Now, after that, 12 years I managed on my own, me and my wife together. But on 2022, because of a wrong medication given by Medanta doctors and then again Batra hospital doctors, whatever, her condition went down and she was totally bedridden and, always on diaper and things like that. That's the time my son said that now I should give a full-time caretaker in the home. Now, what I started talking about is this, the affordability, right? Now, a full-time caretaker nurse costs about 30,000 rupees, roughly I'm telling, okay? That is not possible from the interest money that we get as senior. Even a person at my level who had retired, and I can understand the other people who have not come up to very senior ranks, that what is the condition? My son, of course, said, Dad, you don't worry. I mean, her salary I will pay. I said, that's fine, that's good. But I want to just take it up this way, that this problem is being faced by all elders, right? And especially you will find in smaller towns and other places where, So something has to be done in terms of affordability. Many people were talking of, okay, the insurance company should come forward or whatever. But point is, if we cannot get money, then we cannot pay for whatever services you people are offering. Now you are doing a fantastic job, no doubt about it. Even for example, the technology what you're talking, I was sitting with my mobile, and in that mobile there is a phone on the camera on my bedroom where I can see my wife from time to time and see that she is okay and the caretaker is there with her, and then there is no problem. I'm quite assured that these are technologies. Okay, these are very, very helpful things. But what about the basic money to take care? Okay, I'm lucky because of my son. But what about the other people? Can they afford so much of expenditure? So, since the government people are not here, what I'm only saying, through the CII, you're all senior people and you're all heading big companies, and you are in touch with CII as well as government, please take this question up, that it is difficult for the elders to give money for their own sustenance unless their children comes forward, right? And this particular thing has to be taken up. Otherwise, I know definitely that all of you must be finding difficult for elders to join up your organization, whatever. Many because of the membership fee. They say they cannot afford the membership fee. I mean, sometimes it is genuine. It is not that they're trying to avoid. It is genuine sometimes they really cannot afford, right? So this is the thing that I wanted to take it up to the CII and to the government, that the seniors are facing this problem. See, every month and every year and all, we find the interest rates are all coming down, right? Now, what do we seniors do? We had worked and we had given our services to the nation, and we had given lots of things to the nation as when you have been working, right? I, on a personal level, I had given number of machines and equipment first time in India. I received a national award in engineering, and in spite of all that, I cannot afford the expenditure of my wife. So this is the thing, if I can't do it, then what happens to the other so many elders all around the country? Kindly take it up at the highest of level and see that this is taken forward. Thank you.
Thank you, Abba. So anybody wants to comment on it? Anybody wants to share?
Very rightly put, sir. We completely resonate, and this is one of the major challenges that we also see with our, very large community that we have at CII. One of the things that I noticed when I was in Japan is, people never retire. And I think, I think retirement as an age concept in our country is a very colonial thing. We should, try and remove that. There should be no retirement, in fact. People should work till whenever they can work. It's like, taking away the sense of purpose in life. So,
I just say against that, I basically retired to earn money, but I teach poor underprivileged children. In the schools, initially I was teaching them on the road, and from there I picked up children, put them into schools, and me and some of my known members, my relations and the friends and all, we support those children. And out of the 15-20 children, 4 we put them to schools, and I'm proud to say that one boy has been just admitted to BTech computer this year, and he comes from a Banjara community. Okay, Banjara community means their parents, they're all illiterate, absolutely illiterate. 3 girls are now in class 12 of CBSE, who are going to appear next year, this year itself, right? 2-3 are there in class 6 and 7. So that time we definitely spend, right? So as far the health concerned, we take care of our health. As far our mental level concerns, whoever can, like I do, teach underprivileged children and keep my mental health okay. But money, I can't compare. That is where I'm stuck. Thank you.
So I just want to add one thing. So if you look at Europe, for example, they have a social system, UK, where the government takes care of people till end of life. They are providing services, but unfortunately this is leading to so much burden on these economies that they're almost, the percentage of GDP spent on health is very, very, very high, and the birth rate is falling, as you know, globally. So this is actually a very big challenge to the entire global society, because at one end we have seniors whose cost is really going up, and either it has to be socialized or someone has to pay the bill, either as a society or insurance, but finally somebody has to even pay the insurance premium. And at the same time, the birth rate is not there. And so there is not enough young people coming into the system. So this is a problem. And now with AI, we are talking about, forget about seniors getting jobs. We are talking about even all the young people losing their jobs. So right now, I would say in the next decade, we are going to have some very, very interesting opportunities and challenges in society. So I don't know if any government even knows what to do, or it's going to be something we are all, as we say, Ram Bharose as far as all this is concerned for now.
Yes, Dr. Rima, you want to say something and then we can conclude.
I think it is a very valid point that Sir brought it up. I have a theoretical thought. The theoretical I'm using because maybe I have not seen all the angles. Seniors work so much, they add so much value to our society, they add so much value to our lives. They have paid taxes and come till here for many, many, many years. Is there a possibility the government can give back portion of the taxes for their old age, whatever level they are? When we talk about LV Prasad model, where the affordable class is paying for the unaffordable class, or Arvind Eye Hospital for that example, the richer people paying it for the poorer people. Is there a possibility where I think there are 2-3 solutions that we can reach up to, that people are incentivized to pay taxes because it will be paid back to them when they grow older, probably. I don't know.
On that note, I think that's a lovely note to close the panel on. I know we are running off time, but would love to thank the panel, and thank you, Dan. That was a good question. I think affordability is so core to everything we do, but somewhere convergence has a role to play. Between insurance, between the works that we are doing, between the lovely elders we serve, collectively, money can come down. There is a actuarial expert I spoke to the other day who said that for a 5 lakh rupee insurance, we end up paying 50,000 rupees, of which 10,000 rupees is just fraud prevention and 10,000 rupees is acquisition cost. That's 20,000 rupees off 50,000. That's the kind of savings that can happen just by having better integration. Thank you so much. You've been a lovely audience, and looking forward to seeing you again next CII conference. Thanks.
Thank you, esteemed panel and moderator, sir. To conclude today's meaningful deliberations, may I please welcome Mr. Joy Chakrabarti to give the closing remarks and felicitate our panelists, please.
Incomplete without yourself.
So I'll take a couple of minutes to formally close this session. We are running it since morning. So as we come to this deliberation today, I would like to thank every speaker, partner, and delegates who contributed their experience and perspective to this important conversation. And today has been a day for clarity and conviction. And many of you may be knowing that this is one of the newest committee in CII, and we are working tirelessly towards the goal what you have shown us today that we need to work towards. The inaugural plenary with Care Economica Naya Daud established the foundation for the day. It reminded us that the senior care is not a sectoral concern but a key element of inclusive growth. The next session on taking care for next generation, aging with dignity, has shown, and especially that is a point you harped on, that when you are in the senior age, how do we take care of ourselves? And some of the very, I think, useful suggestions and comments came from this last panel. The next was a fireside chat on Asian values, reminded us of the strength in our traditions, respect for elders. The subsequent session on healthcare, housing and insurance reinforced that these pillars are interconnected and how it can together sectorally contribute for the further development for the elderly people. The storytelling session, Zindagi Ka Rang, brought the human dimensions into focus. And the final session on connected seniors showed how technology can be a bridge rather than a barrier, and how it can be made friendly for the seniors and they can make use of it. Across all sessions, one truth emerged clearly, that aging is not a challenge to be managed but a stage of life to be valued. As the chair of the CII Committee on Senior Care, I take forward the insights shared today, and the committee is working closely together for some of the solutions, some of the recommendations, and for some of the discussion what we can have with the government and other healthcare institutions. Let me express my gratitude to all our dignitaries, speakers, moderators, participants for their commitment and support. Your contributions have strengthened the vision of an India where every citizen can age with dignity, independence, purpose, and I'll add another thing, with empathy, not sympathy. Let us continue to collaborate and build an ecosystem where care is not a privilege but a right, and where every citizen feels valued, secured, and connected. Thank you very much, and we'll look forward to seeing you soon next year.
Thank you, sir. Ladies and gentlemen, you've been a wonderful audience. Thank you so much for joining us for the Senior Care Conclave 2025. Look forward to welcoming you next year. Have a wonderful evening. Thank you.